Hello,
Hello, this is
from
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 Vietnam.
Vietnam,
Yes,
speaker Sud. Good morning, DG. Thank you for joining us.
good morning.
So we can hear you loud and clear. How is our reception?
We can hear you very, very well.
Thank you.
Thank you.
Good morning, Mr. Hansberg.
Yes, good morning. How are you?
Okay, we just would like to identify we have the correct person.
You have the correct person. I'm the one.
Thank you very much. We will mute everybody at the moment, and then after that, for each speaker, we will unmute it for all of you.
Okay, great.
Thank you
Thank you.
very much,
Looking
Mr.
forward to it.
Hansberg.
Okay.
Selamat pagi, Bu Ama.
Selamat pagi. Kedengaran suaranya?
Kedengaran, Ibu. Terima kasih.
Iya, sama-sama.
Kita memastikan bahwa Ibu sudah online, Bu.
Iya, tadi maaf tidak join.
Baik, Ibu. Terima kasih, Bu. Kita akan nanti kembali
Sama-sama.
ke Ibu, Bu.
Ya.
Good morning, Vietnam UOC GD. GD. Good morning, Vietnam Preventive Medicine. Can you hear us?
Yes, good afternoon from Vietnam. We hear you clearly.
Okay, thank you very much.
Welcome.
Hi, Dr. Jim.
Hi.
Oh my God, it feels like a dream to see you in person.
1 minute, 1 minute. I nak pasang head.
I mean, virtually in person.
Nak apa ni? Lagi mic awak ni. Apa benda tu?
And His Excellency
Okay.
Kung Pak, Deputy Secretary General of ASEAN. So honored to have you with us, Your Excellency.
Thank you very much for having me. How are you?
Managing so far. Thanks to the pandemic. We are trying to stick to the health protocol here. Thank you so very much for all the participants. I'm Yuliana Bahan from the embassy, and this is our Sergeant d'Affaires, Pak Fikri.
Hello, everybody. All right. Good morning, good afternoon, everybody. Excellency Deputy Secretary General, ASEAN for the ASEAN Social Cultural Community, Excellencies and honorable speakers, distinguished participants. On behalf of the ASEAN Committee in The Hague, or ACTH in short, I would like to welcome all of you to our webinar on COVID-19, Pandemic Mitigation in ASEAN, Lesson Learned and Potential Cooperation with the Netherlands and European Union. Before I proceed, allow me to begin with a short introduction about the ASEAN Committee in The Hague. ASEAN Committee in The Hague, or ACTH, which is established in 2015, is a forum for 5 ASEAN embassies based in The Hague, namely Indonesia, Malaysia, Thailand, Vietnam, and the Philippines. The main purpose of this committee is to promote and enhance understanding of communities in the Netherlands about ASEAN and the ASEAN community. Ladies and gentlemen, in the global pandemic, presence of international cooperation and collaboration is vital and certainly calls for a collective action. Some extra measures have been taken or at least underway at the regional and global levels to include the path toward transition and recovery. Under the ASEAN chairmanship of Vietnam, countless virtual discussions had been held to formalize the 7 priorities set out in the declaration of the Special ASEAN Summit on coronavirus disease. Within the European Union itself, EU leaders have been meeting to strike a deal on recovery plan. At the global level, the UN Comprehensive Response to COVID-19 set out to save lives, protect societies, and recover sustainability. UN development and humanitarian entities have also developed their own specific guidelines to ensure that no one is left behind. Under this purview, and as a way to follow up the declaration on the ASEAN Special Summit on coronavirus disease, this webinar is held. There are 2 main purposes of this webinar. First is to reach out with different stakeholders and learn from ASEAN countries and Netherlands, and also the EU, on their responses to the pandemic, including their best practices and challenges, and to identify the potential future cooperation in pandemic mitigation, early detection, recovery, and prevention. To evaluate and the adequacy of the existing framework and institution, especially at the global and regional level, in responding to current and future outbreak of pandemic, as well as address the healthcare needs, especially to the most vulnerable and disproportionately affected group of society. Ladies and gentlemen, excellencies, the webinar will consist of 2 panel discussions. Panel discussion 1 will focus on the experience of ASEAN and EU in mitigating the COVID-19 pandemic, on national effort, progress, and challenges, including in achieving SDGs, while panel discussion 2 will highlight the pandemic from humanitarian and gender perspective. Each speaker will be given a maximum of 7 minutes. Participants or viewers are invited to give written questions during the presentation in the chat room. This question will then be read at the question and answer session. Question and answer session will be made after all speakers have delivered their presentation. Ladies and gentlemen, as we are about to embark to the panel discussion 1, we are truly honored to have speakers with commendable credentials and remarkable portfolios. First and foremost, I would like to welcome His Excellency Kung Phuoc, the Deputy Secretary General of ASEAN for ASEAN Social Cultural Community. His Excellency Kung Phuoc is appointed as the Deputy Secretary General of ASEAN for ASEAN Social Cultural Community from 2018 until 2021. He supports the ASEAN Secretary of ASEAN by providing leadership in implementing the ASEAN Social Cultural Community blueprint while leading the ASEAN Social Cultural Community Department of the ASEAN Secretariat. The second one, we have Her Excellency Dr. Jamilah Mahmud. Dr. Jamilah Mahmud is Special Advisor on Public Health to the Prime Minister of Malaysia in Kuala Lumpur. She advises the Prime Minister on the current coronavirus pandemic and other health and security risks, and also develop a new health reform strategy for Malaysia. Speaker number 3, we would like to welcome Dr. Oscar Primadi, MPH. He is at the moment is the Secretary General of the Ministry of Health, Republic of Indonesia, and also the chairperson of ASEAN Senior Official Meeting Health Development. Speaker number 4, Her Excellency Ambassador Exiri Pintaruchi. Ambassador Exiri Pintaruchi is the ambassador of the Kingdom of Thailand to the Kingdom of the Netherlands. Her Excellency was appointed to as the ambassador of the Ambassador Kingdom of Thailand to the Kingdom of Netherlands in 2018. Before assuming the office, Her Excellency was assigned as Deputy Director General for International Economic Affairs, Ministry of Foreign Affairs of Thailand. Her diplomatic posts include Royal Thai Embassy in Seoul and Permanent Mission of Thailand to the United Nations in Geneva. Speaker number 5 is Mr. Dang Nguyen Tan. He is the Director General for General Department of Preventive Medicine, Ministry of Health, Socialist Republic of Vietnam. Mr. Dang Nguyen Tan main responsibility include communicable disease surveillance and response nationwide, border health quarantine, field epidemiology training program, and also international health regulation, including international health regulation, national focal point. And at the moment, he is also Director of Global Health Security Project for the Ministry of Health of Vietnam. Our last speaker, but not the least, is Mr. Hans Beck, Regional Consultant for National Republic Health Institute, or RIVM in Netherlands, Kingdom of Netherlands. As the public health physician, Mr. Beck has worked for over 20 years in various African countries at district, regional, and also national level. Since 2016, he works at the Regional Public Health Organization in Netherlands, especially in the infectious disease control and response. With that, ladies and gentlemen, let's go to the panel discussion 1. Before we go to the first speaker, I just would like to set up the framework so every viewers and participant can also relate to the webinar. We are all indeed anxious to hear what we can collaborate, discuss more, and explore international cooperation in addressing health security. It is thus timely, if not overdue, to ponder on the effectiveness of the already existing framework and institution at all levels. Nevertheless, questions do remain. Do we have the needed resources and capacity to translate commitments into concrete action and tangible results to ensure protection and the delivery of needs for all? especially for the most vulnerable and for those disproportionately affected by the pandemic. Are the existing institutions and framework adequate enough to prepare states and society to address the pandemic situation? And probably most importantly, to enable them to prevent, early detect, mitigate the pandemic and recover from future pandemic, including the crisis. What we can do differently to ensure that national international cooperation, including collaboration toward equitable access to certified and affordable vaccine and medicine can become usable tools and means of implementation toward achieving attainable standard and health, thus preventing the mitigating of impact of future pandemic and crisis. And of course, we would like also to hear what can ASEAN and EU with a combined population of more than 1 billion do more to ensure that their partnership would bring benefit for all. And interestingly, how can Netherlands serve as the potential hub to bridge and foster even stronger ASEAN-EU cooperation, including in public health and prevention of communicable disease? Before the speakers can answer all of those questions, let us begin with the first speaker, His Excellency Khun Kwak of ASEAN. Your Excellency, the floor is yours.
Thank you very much, Mr. Ambassador, for having me in this panel discussions. And also good afternoon to all ambassadors in the Netherlands and colleagues in the regions, and Dr. Jamila, good to see you again. There's no doubt that the COVID-19 has severe impacts on the region. It started as a health crisis, but it turns out to be the social crisis, economic crisis, and even security crisis, to some extent. So rather than, giving details on what's going on in ASEAN, and I'm sure Pak Oscar will give more comprehensive updates on how and what the health sector has been doing to respond to COVID-19. I would like to look at ASEAN key initiatives and group them in 4 areas. And of course, Pak Oscar will give more details on each one of those. The first one is the institution. Shortly, after the outbreak, under the chairmanship of Vietnam, we come up with the ACCWGPHE, it's a long names here, the ASEAN Coordinating Councils Working Group on Public Health Emergency, which is the coordinating bodies. It coordinates all the relevant, pillar, so that when we are responding to the pandemic, it's going to be comprehensive and cross-sectoral. We also look at, further strengthening the regional institutions as well. Of course, we have the Emergency Operations Center, which was established many years ago, and it was the institution that is instrumental in the response to COVID-19. But we also look at ways on how we can leverage on this and further strengthen the regional institutions. So we are working on the feasibilities or the possibility of establishing the ASEAN Center for Public Health Emergencies and Infectious Disease. And hopefully the recommendation from this study will be useful in terms of what will be the future directions of our regional mechanism in responding to not just COVID-19, but also future crisis of these magnitudes as well. We also look at how we can further strengthen the EOC network, which is now in Malaysia. They've been doing many good jobs in responding to COVID-19. But of course, there's also a number of areas that they would like to look at and further improve as well. We're also working closely with partners to conduct tabletop exercises, so that we can respond to the pandemic, not just from the health perspective, but also from the perspective of other, relevant sectors as well. As I mentioned, because it's not just the health sector that is impacted, heavily from this pandemic, but also many other sectors as well. The region also talked about the regional stockpiles and also the joint task force with partners and so on. So these are, part of the institutional, building that we are trying to do to respond to COVID-19. When it comes to policies, we also, talking about the standard operating procedures for regional response to COVID-19, and this can be used for future, pandemic or crisis as well. We're also talking about public health guideline, recovery framework plan, and also socioeconomic impact study and rapid assessments. So all of this will contribute to our policy discussions on ways and how we are going to address it. We also work hard on the resource mobilizations as well. Ambassador already mentioned about the COVID response funds, and we are also tapping into the ASEAN agreement on disaster management emergency response funds as well, in addition to the national resources, which account, a huge chunk of the resource that we are going to use to respond to COVID-19. We are also initiating a number of platforms so that we can, work closely with our partners. We're having dialogue with, China, Japan, Korea, the US, EU, and France and e-police, so that, our medical expert can share experience, expertise, and how, we can best address all of this problem. So I think here probably one of the areas that, we can further strengthen, with the participation of colleagues from the EU and the Netherlands in particular. Now, when it comes to our response to the outbreak, I think when we first received the notifications of abnormal pneumonia case, from our colleague, from China, the member states have been forceful and swift in the response. But of course, we never, imagined that, the crisis will be at this magnitude. So there's a lot of problems, and ASEAN is not unique, when it comes to the shortage of PPE and the test kits and the vulnerabilities of our, frontline workers. That's why we can see high numbers of infections among our healthcare workers and so on. So that could be a very good lesson for us, when it comes to future pandemic. We can't just assume that it's going to be, at the degree that we can manage it. I think we should also be prepared for the worst as well. That's why, some of the initiatives that I just mentioned, the regional stockpile, the response funds are, aimed to address some of the problems that we encounter during our, first stage of our response to COVID-19. The mantra is still the same: test, trace, treat, and we are trying our best, to do this. A lot of member states have put in place and still put in place the social restrictions and even partially lockdown. But even with social restrictions and partial lockdown, we still need to do all of the necessary tasks here, which is to test as many as possible, to trace all the contracts, and to treat and save lives as many as possible. But of course, going forward, I think we have to also have a serious conversations, not just among the member states, but with our partners as well. You probably know already that our leaders have had a numbers of high-level discussions with Class 3 leaders, with the US, with many other countries. And one of the main purposes is to make sure that we can have a high-quality, effective, affordable, and equitable diagnostic, therapeutic, and vaccine. We also talk with the private sectors as well, how we can make the distributions of vaccines more equitable and make the vaccines more affordable. And of course, we all agree that it can't be just one candidate. We need multiple types of vaccines so that we can have enough to provide to our people, especially frontline workers and vulnerable populations. Although we are now preoccupied with responding to COVID-19, but I think we shouldn't lose sight, of our long-term strategies as well. Actually, if we have, some of this in place, we can actually save many more lives. For example, universal health coverage, high-quality healthcare systems, strong laboratories, and the strong capacities among our frontline workers and doctors and nurses and so on, and the advanced systems and equipment and research innovation in the regions and so on. So these are the things that I think, going forward, we have to have a serious conversation. We can't just, focus only on what we need to do now. Of course, the situation pressures to just think about how we are going to address COVID-19. But, some of the problems that we encounter is also related to, our long-term investment in our healthcare systems as well, and making sure that all of our people, can have access to high-quality healthcare services and so on. Now, we are not just working on the response to COVID-19 and to save life, but I think we are now also working on the recovery plan or if not a plan yet, it's a framework so that member state can return to some degrees of normal. It's a tricky question because it's not going to be an easy one. We learn from the experience of other countries, and already we can't too quick to open. So we have to make sure that when we are doing it, we do it in a ways that is safe for our people, that will not put more lives in danger. And of course, health sector would play an instrumental role in this. So we need to further discuss on this. From the ASEAN side, we are going to host a number of webinars, and we are going to engage a wide range of stakeholders, not just the people from the sectoral body, but also colleagues from academic institution, private sectors, and to discuss what is the best way for us to reopen our economy, and when would be the times for us to do so. And of course, health is going to play a very important factors in our discussions here. For example, the sectors that are hit the hardest, for example, travel, hospitality, things will not be the same. Let's use the travel as an example. Taking a taxi from my apartment to the airport is a big risk already. So how we are going to do that? And then when we arrive at the airport, getting the boarding pass, going through the security, immigration, getting on a plane, and then on the arrival. So we have to have a clear plan on how we are going to do all of this. Of course, some of the colleagues here might have heard about the travel bubble or something that we are now trying to establish within the region and also with partners as well. But it's still an experiment. There will be a lot of questions and experiments there. And we are happy that some of our partners are willing to share their best practices when it comes to this, because as we know, for example, Australia is now trying to do the same things with New Zealand, but I think because of the spike in Australia, and then New Zealand is also talking about whether it's viable for them to do so. So there's a lot of moving things here. Nothing is certain yet. And also, when it comes to reopening the economy, it's also about returning our workers back to the workplace. So how we are going to do that? How we can make sure that the return to work is safe and the workplace itself is safe. From the ASEAN side, the ASEAN health sector is working on the guideline, and with that guideline, then we can inform the private sectors and also relevant sector on how they can do it in a safe manner. But again, we can't take things for granted here. There's a lot of uncertainty, and we have to be agile when it comes to our response. And given the experience and also the lesson that we observe from many of our colleagues overseas, I think it's still a long shot for us. The last point, although it's not directly related to COVID-19, but I think this is something that we should also pay serious attention as well. Two of them. One is on social inclusion. As I mentioned, now we are preoccupied with responding to COVID-19 and so on. But this issues, deserves serious discussions as well, because, for example, pandemic, does not affect people equally. Some are shouldering, heavier burden of the pandemic, especially our vulnerable population. For example, the elderly, people with disability, and the poor, and so on. And it's heartbreaking, to hear some cases that because of the overcrowding of the ICU beds, and they have to sacrifice older people, and to save younger ones. So this kind of issue, I think, when we are having some grip on the pandemic, and then we should have a serious conversations on as well. The same for physical distancing. I think it's easy for me and some of our colleagues here to work from home, but for many people, it's a decision, it's a choice that they need to make. Whether they get infected or put the foods on the table, and it's a difficult decision. And many people choose the later because they don't have a choice. So how can we, come up with better ways to support all of these people? Protecting health is also important, but some people might just die because of the lack of foods or the lack of other support. And I think we need to look at the response from a more comprehensive perspective. The same for people living, under poverty line. According to the World Bank, if the global economy contract like by 6%, 70 million of people will fall under the extreme poverty line. And many of the people, who still live under poverty line, are in ASEAN regions as well. And if the contraction is up to 10%, then or 8%, then the numbers of people who live under poverty line will increase by 100 million. That's a big number. So it's undo, a lot of achievement that we have achieved over many decades that we are trying. So I think this is something that we have to also keep in mind as well. And one of the problems that we have when it comes to the pandemic is the environmental sustainability issues as well. When we look at the root cause of all of this, the invading of the natural space and so on, the biodiversity depletions, the consumptions of wildlife and all that. I think these are the issues that we should leverage on the current crisis and have a serious conversations on this. Of course, it's difficult. One can say is that it's our value. We consume some of this for medical purposes and so on, but that's not the right way to do it. And we should be more forthcoming when it comes to this, and be bold in our decisions to put in place rules and regulation that could stop this from happening. And again, climate change is a big issue here, but it is also timely for us to engage in a serious discussions. The link between public health and climate change, and also the pandemic. The last point that I would like to raise, which is also related to the topic here, is how we can further strengthen our global partnership. Pandemic is a transboundary issues. It needs a lot of coordination, not just among ASEAN member states and our partners. We've been doing quite well, in terms of our collaboration between ASEAN and countries in the region. Asia Pacific, we've been working very closely with EUs as well. But now I think it's not just about our collaborations in terms of knowledge sharing, but it comes to a very difficult topic, which is how we can ensure vaccine is widely accessible and affordable. And this involves economic calculation. We can't just ignore the fact that it's some things that will incur a lot of costs, and this is some things that the private sector will also look at. Last time when we had the discussions with private sector, and we had a good conversation with Pfizer, Johnson & Johnson, and many others. I think they put a lot of money into all of this, and I think the ways of how we are going to make sure that the distributions of vaccines and diagnostic or therapeutic will be affordable and equitable. This is some things that we have to have a frank conversation. And it's not just about how much we can make, but how much and we can support one another, and how many lives we can save. And this is not just the problems of one country. And if any parts of the world is still vulnerable to pandemic, no one is safe. So I think it's in the benefits of all to have a strong solidarities and contributions and the sense of sharing, when it comes to the development and the distributions of vaccines, therapeutic and medicine. I'll stop here, and if there's any question, we will continue the conversation. Thank you very much, Ambassador.
Thank you very much, His Excellency. Now I would like to give the floor to Dr. Jamila Mahmood. You have the floor.
Unmute myself. Thank you very much, Your Excellency. Your Excellencies, ladies and gentlemen, it's a pleasure to be on this webinar. I would like to first of all thank the Indonesian mission in The Hague for taking this important initiative, and to say as well that ASEAN has done a remarkably good job. I feel that the Secretariat plus other partners have really brought together a lot of good thinking around what to do with the COVID-19. Allow me to spend a few minutes just to share Malaysia's experience and then maybe a few recommendations how we can move forward. Malaysia is fortunate that, experience is a very good teacher. SARS, H1N1, the Nipah virus epidemics that we've experienced have allowed us to actually strengthen our pandemic preparedness playbook. And therefore, when the first cases were announced in China, our Ministry of Health has really put in place the standard operating procedures in preparation for a likely pandemic. Malaysia also had a very interesting political situation during the pandemic, because we had a change of government in the middle of, in fact, the height of the pandemic. And therefore, can you hear me? Yeah. And therefore, that added a layer of complication. But the good thing is, data, evidence, science prevailed. And as everyone knows, we take an approach of test, trace, isolate, and treat. And we did the same thing, following WHO recommendations. Now, the challenge then came, and of course, we're in full admiration of Vietnam, who made the decision very early on to close the borders. For us in Malaysia, like many other ASEAN countries, our borders have many neighbors, and movement of people was quite a situation, because there was a risk of transmission, of course, with people moving back and forth. Now, the Ministry of Health presented evidence on a daily basis, and we had these meetings, and we use data to actually guide us into making decisions. And I think this has been a very critical point for us. At the height of the COVID-19 infection in Malaysia, we had a reproductive rate of 3.55. Basically, it means one person could possibly infect 3.55 people, and that's high. So what happened is that, the decision then whether to have what we call a movement control order, a restriction of movement, basically a lockdown. And this was a very difficult decision to make, because we all know that the balance between health and economy is a very difficult one. As a government, we have the impact of COVID is something like 2.4 billion ringgit a day in terms of economic loss. So, but thankfully the leadership in the country used the evidence, and I want to show a slide now, if it can be shared, that looked at data and evidence, not just in number of cases, but also recovery rates, the number of hospital beds that are available, and so on and so forth. If you can just show it as a slide. Now, this slide just shows you how we use data, and you can see the first MCO, second MCO, third MCO. Basically, those were the movement restriction orders, and then looking at the numbers. And the graph in blue shows that if we follow procedures, we will expect the numbers to fall, and if we don't follow procedures, we will expect the numbers to rise. And the procedures we put in place, of course, was border controls, but also one thing very important to remember in pandemic management is it's not just the government that has to be responsible, it's actually the public. So getting good public communications out to the citizens to say, you need to play your part, you need to wash your hands, you need to put on a mask, you need to maintain good physical distancing is critical, and in fact is the critical success factor in managing a pandemic. Now, what we did was to build that trust, and I think this is another very important point, is that how do you build trust in a pandemic if you need the public to trust you? And this is where we had, the Director General of Health in Malaysia, not a political figure, a scientist, a doctor, came out on television every day to millions of viewers around the country to convey the numbers, the data, the evidence, and then to say, you need to stay at home, you need to wash your hands, you need to put on a mask. And I think that public confidence in the health system and the health director played a major role. And you can see from the graphs that we have actually achieved every single projection that we made. These graphs show a projection using the SIR techniques, and you can see that we managed to push down our reproductive number to less than 1 before we started to ease our restrictions of movement control. Now, of course, that has impact on the economy, but the government then had to kick in some economic measures in terms of support to the public, particularly the poorer communities, small, medium enterprises, and so forth. And I think that, moving forward, we are now in a recovery phase. Our reproductive number is less than 0.3 now. It's very low. So we have no local transmissions for the last few days, but still we're getting cases that are tested positive when they return to Malaysia. And therefore, self-quarantine and so on and so forth has to be in place. And then using technology with apps and to trace and to be able to identify the movement of people. Now, what we are worried about is that we've done everything possible in terms of the government and the health systems to protect the people, but whether the people will continue to practice these good social behaviors, because this will be essential to us avoiding a second wave. You may have heard that WHO is predicting a second wave, particularly in Europe and the West, around September to October. So we have to make sure that we don't go down that route. So I think public engagement is extremely important. For ASEAN, I think there are lots of lessons to be learned. There are many countries in ASEAN that are doing very well, and that, we need to be able to document this and bring this together. And I think that, as His Excellency Kung Pok said, it's very important that we look towards, what happens when there is a vaccine. We have 19 vaccine trials going on around the world. Some of them are already in stage 3, and that means that they might be ready for, wider testing and also production very soon. And then we know that takes time. You would have known about the COVAX facility that looks into pooling resources for vaccination production and distribution. I think ASEAN needs to come together and look at how it as a regional bloc actually does mass procurement for the region, because this has to be a public vaccine that is available to everyone. How can ASEAN support each other and bring the 600 million population to be not at risk, and to be able to pool and have greater buying and negotiating power in terms of vaccine procurement, but also vaccine production. It's about time, I believe, that ASEAN has its own CDC, a Center for Disease Control, ASEAN-based regional health research, ASEAN-based regional innovation, vaccine production, test kits production. It is possible. So I think this is how I think we have looked at the future, because this is not a black swan event. This pandemic was a matter of when, not if. We have had all the telltale signs, and rightfully pointed out by His Excellency, the Deputy Secretary General of ASEAN, that a pandemic doesn't arise on its own. It is because we have disrupted the environment, the ecosystem, the movement of people, and social behaviors of people as well. So I think my 7 minutes is up. I'm going to pause here, and then we can carry on later. Thank you very much.
Thank you very much, Dr. Jamila. Now I would like to give the floor to the third speaker, Dr. Oscar Primadi. You have the floor, Pak Oscar.
Yes. Thank you, Pak Fikri Kasidi, the Charles, the Affairs Embassy of the Republic of Indonesia. Slide, please. His Excellency Kung Pok, Deputy Secretary General of AACC. Excellency Dr. Jamila Mahmud, Special Advisor to the Malaysian Prime Minister for Public Health, Ambassador of Thailand, Her Excellency Eksiri Pintaruki, Mr. Dang Quang Tan, Director General, General Department of the Preventive Medicine, Vietnam, distinguished delegates, ladies and gentlemen, good afternoon from Jakarta. As the current chair of the ASEAN Health Ministers and the senior health officials, I'm pleased to share the summary of the collective efforts of Asian health sectors in responding to the COVID-19 pandemic. Next slide, please. After immediately responding to the outbreak in early January 2020, the Asian health sector sustained and further expanded its intervention through existing mechanisms and platforms in cooperation with the Asian non-health sectors and other external partners. We have continued to share situational updates, technical exchange, real-time critical information via electronic communication, and mobile instant messaging through the Asian Emergency Operations Center Network for Public Health Emergencies. 2, share the preparedness and response strategies, good practices and lessons, as well as operational challenges, gaps and needs within the Asian and with +3 countries, Italia, United States, through the webinars, health cluster and EOC network platforms. 3, regular reporting on the risk assessment for international dissemination of the COVID-19 Asian region through the Asian Biodiaspora Virtual Center. 4, carry out the exchange on disease surveillance and laboratory readiness and response and technical material support through the existing health networks in ASEAN. 5, cooperate with the non-health sectors and partners to enhance ongoing COVID-19 response, as well as strengthen preparedness through the new initiatives and support national risk communication efforts, including addressing false information and fake news through the Asian Risk Assessment and Risk Communication Center. Next slide, please. Excellencies, ladies and gentlemen, as the Asian health sectors continues its response according to the evaluation and the trajectory of the outbreaks in AMS, the Asian Health Ministerial meeting was convened in April 2020, as well as engaged with the Health Minister of China, Japan, and Republic of Korea through the ASEAN +3 platform, and with the United States in the same period. They outlined priority policy and strategic direction for the Asian health sector, including enhanced cooperation with the partners, among others in the following areas: exchange of timely data and information on COVID-19 prevention, detection, control, and response measures. As second, regional cooperation and risk communication on COVID-19, and then utilizing digital technology and artificial intelligence to facilitate timely implementation of public health response. And then cross-border contact tracing and outbreak investigations, and capacity building and resources mobilization, support timely provision of technical, material, and financial resources critical to sustaining national health system response, including drug and vaccine security and self-reliance, and ensuring access to essential healthcare services for vulnerable groups, and research and development on innovative tools and intervention, and the last, strengthening and institutionalizing regional mechanism in ASEAN and with the various stakeholders. Next slide, please. Excellencies, ladies and gentlemen, collaboration and solidarity is critical in this extraordinary, unprecedented global health crisis require cooperation of the international community. The cooperation with the dialogue and development partners had been harnessed and result to assistance and the new initiatives that aim to enhance the current response and ensure future preparedness. This include enhancing detection capacity for COVID-19 in ASEAN member states with the Republic of Korea. And then development of an ASEAN portal for public health emergencies with the Canada. Feasibility study on the establishment of the Asian Center for Public Health Emergencies and Emerging Diseases with Japan, and research and innovation initiative on COVID-19 with the European Commission. Formulation of the Asian Public Health Emergencies Coordination System with the United States and the cross-border contact tracing and outbreak investigation to be led by Indonesia. And continue with the relevant programs for COVID-19 through the Mitigation and Biological Threats program supported by Canada. And then technical assistance and exchange and provision of medical supplies and equipment at bilateral and regional levels with China, ROK, and in Canada. And WHO, WPERO, and WHO CRO are proposing a proposal of cooperation to Asian and Asian partners that include activities in Asian member states and the component of support to regional coordination in the region to better respond to COVID-19. The next slide, please. Excellencies, ladies and gentlemen, ASEAN recognizes that the pandemic requires in an interpillar and intersectoral response at various levels, hence promotes new initiatives at the ASEAN-wide level. After overcoming this COVID-19 pandemic, ASEAN commits to formulating a standard operating procedures for public health emergencies and strengthening contact tracing and rapid outbreak investigation, establishing a broader platform for public health emergencies and emerging diseases preparedness, response, and assistance, as well as for better cross-sectoral consultation and capacity building. The Asian health sectors considers this forward-looking initiative as opportunities to expedite the realization of more comprehensive and integrated regional health security. Next slide, please. Ladies and gentlemen, we do believe that this unprecedented event of the COVID-19 pandemic will strengthen regional and global solidarity and collaboration. The Asian health sectors reaffirms its commitment to do its best to carry out initiatives to protect the people of ASEAN from the dangers of COVID-19 and other public health threats in the future. Thank you. Thank you very much.
Thank you very much, Mr. Secretary General. I would like now to turn the microphone to Her Excellency Ambassador Exiri Pintaruchi. You have the floor, Ambassador.
Thank you. Excellency Deputy Secretary General for ASEAN Socio-Cultural Communities, distinguished panelists, and all participants. Good afternoon. It is my pleasure to take part in this online discussion to share Thailand's experience and lesson learned in fighting the COVID-19. I also wish to thank the ASEAN Committee in The Hague for this initiative. And as mentioned earlier by the moderators, that COVID-19 has become a collective challenge for the international communities. As we are trying to find the vaccine and treatment, every country has to deal with the situation at hand. I hope that the lesson learned that Thailand has from our experience would be useful to some extent. Like many other countries, Thailand was caught off guard by the rapid attack of the virus. as in early January, we were among the very few first countries that was detect the local transmission. And the situation got escalated as to a certain level that we have the rising number of the infection to the second highest number of infection after China. But we have managed to bring the situation under control with a currently no report of domestic transmission of COVID-19 for more than a month, while new case of infections are those who return from abroad, all of which are well contained in the allocated quarantine facilities. But despite this improved situation, we remain alert and vigilant. Now, I wish to share some lesson learned in our case that our approach which has seems to prove work in our situations based on 4 key elements. The first is our decision to apply a rapid timeliness and measures with multi-sectoral approach. Our first case of local transmission was detected in early January. We decided to activate our emergency response right away in early January and have our health experts to lead the decision. You may recall that the first report of COVID case in Wuhan was disclosed to the public at the end of December. So that was quite a quick decision from our health team. And to have the health expert lead the management of the crisis have the plus point in terms of the decisions which would or need to have a decision that based on correct data. But that is not enough and sufficient because we also face the sharp rise in number, as I've mentioned, during the late January and February, that at one time we have the second highest number of infection after China. That urged the necessity of the government to make a decision to have more closures or lockdown. We decide to have the emergency decree and to have a more cautious lockdown to ensure swift, integrated, and effective response. Some stringent measures need to be introduced, such as ban on international incoming international flights, some curfews, and some closures of educational institutions and certain establishments. These measures were deemed necessary for the public safety and welfare at that time, and were only temporarily. With the nationwide efforts and public cooperations, we were able to ease and relax these measures within short and consecutive phase since May. And we are now entering the phase 5 of relaxation of measures since July 1st. But anyway, we cannot afford to have the second wave of infection during phase 5. Since we are now reopening business and restart activities that may pose a high risk. So we need to maintain some relevant measures and authorities to ensure continued public health safety. Our second elements relate to the strategic active case testing method. Our health expert made a decision to pursue active case testing methods based on the data and statistics, rather than opting for the random testing. And this seemed to prove to work because they would target testing at the high risk close contacts of infected persons. But apart from this, the authorities are also currently carrying out 150 COVID tests for every confirmed positive case, which is already a high ratio for our situation. The third key elements in our approach is in promoting universal precaution, which is based on the assumption that everyone is infected and can be infected, and to act accordingly. This means that we ask for public cooperation to practice preventive measures, such as wearing masks in the public areas at all times and observe personal hygiene and physical distancing. And we have received full support from the public, mostly, and most dedications from the public health officials who work extremely hard to help isolate and tracing close contacts of the patients. Another key factors that help us most efficiently and also show the inclusiveness in our approach is the network of village health volunteers of more than 100 million members across the countries that have been knocking doors on people's house to give advice on personal hygiene and to identify people at risk. And this help us a lot in our efforts and have been forming another chapter of our successful stories of health campaigns and the way we work the public health authorities and the civil societies. Our fourth element is inclusiveness. This is in what we found in our approach. This crisis has not only proved the efficiency in our healthcare system, despite the fact that we have relatively low numbers of health workers per population. It also proved the efficiency in our universal health coverage as well. But the most important thing is that the importance that we put on the people at the center of whatever we do. We are trying to look after every segment of society, in particular the vulnerable group, as also mentioned earlier by some of the speakers earlier, and on the basis of inclusiveness and non-discriminations. And we have numerous measures were implemented to tailor to the different needs of these vulnerable groups, including low-income citizens, women, children, youth, the elderly, persons with disabilities, and migrant workers. And looking forward, we can say that because of the stringent measures and the lockdown, we have to sacrifice the economies. And with this, we are trying at best to recover and resume back. And we are not yet completely returned to normal, which we are trying our best to have this opportunity at phase 5 to have our business activities to resume, to recuperate and mitigate the impact, the economic and social impact of the pandemic, which are now we see a lot of activities that coming back to normal. And another challenge that we found is that like many other countries, our economies are deeply integrated to the global and regional supply chains, which has been badly affected by the disruptions of the global economic activities. The government therefore spent more than 10% of our GDP on the 3-phase economic measures to mitigate the impact of the lockdown on the livelihood of the people, ranging from soft loan, debt moratorium, cash handouts, extending tax filing deadlines, and establishing corporate bond liquidity stabilization fund. I think similarly to what the Dutch government has been doing. Now, we are seeing this challenge as an opportunity to rethink, reboot, and reconnect our social and economic strategies by being mindful of this new challenge to be able to achieve the SDGs better. But we cannot do it alone, and we think that it's important that ASEAN's working more closely together, as mentioned earlier by all the previous speakers, that we welcome these efforts, not just only the work among ASEAN member states, but with our partners, our external partners, and in all various forums. And in terms of the way that we see the potential collaborations, potential areas of collaborations between ASEAN and the Netherlands and EU, we see that there's a lot of possibilities and ways to work together to achieve transformative change that needs to tackle these pandemics and to better achieve the SDG, such as also mentioned a lot of time by previous speakers, that is in sharing of experience and best practice, also to improve with a view to improve capacity building, to better prepare for the pandemic and future health emergency. This should also aim to develop resilient, responsive, and accountable public health emergency system. And another area is that we need to work to minimize disruption of supply chain connectivities. And ASEAN and the Netherlands and EU can work closely, very well, to reaffirming our commitment to continuing free, fair, and open trade environment in order to speed up economic recovery. And emergency measures to combat COVID-19 pandemic should be targeted, proportionate, transparent, and not create unnecessary barrier to trade while adhering to the WTO rules. Another area that is also important that and can be potentially an area of cooperation is to work on to enhance transformation in digital infrastructure, to render important services, in particularly telemedicine, to be more widely accessible, for example. In fighting the pandemic, what we also found that is equally important is to ensure access to safe food and clean water. This is also another area where ASEAN, the Netherlands, and EU can have great potential to work together to improve competitiveness and productivities in our agriculture, food, and water-related sectors through wider use of technology and innovation, exchanging of knowledge and expertise, and to ensure that our way of work would be more sustainable to natural resource and environment. And last but not least, another area that have also been mentioned very likely by the previous speakers is on the development of vaccine and medicines, which once available either in the ASEAN efforts or with a cross-regional efforts or the global level, it should be considered as global public goods that should be adhered to the principle of equitable access to vaccine and treatment for all. So I'll stop here. Thank you.
Thank you very much, Ambassador. Now I would like to turn the mic to Director General Dang Wang Tan. The floor is yours, Director General.
Thank you very much, Mr. Chairman, Mr. Ambassador of Indonesia, distinguished speakers, ladies and gentlemen. Excuse me.
It seems that we have echoes from your side.
Okay.
Maybe it is near too close to the same how do you call it, same apparatus that doing the same thing.
Yeah. Thank you. Do you hear clearly?
Do you still have echoes, Mr. Director General?
Good evening again.
This one is better.
Do you hear me clearly?
Not at the moment.
Hello. Good evening. Good evening again.
Yes. Good evening. Can you hear me?
Yes, I can.
Now this is better. Please, Director General.
Ambassador to Indonesia, distinguished speaker, ladies and gentlemen. First of all, I would like to, on behalf of the Ministry of Health of Vietnam, to thank you very much to invite Vietnam to join this webinar. I think that this is very important and very interesting. Firstly, you know that the COVID-19 pandemic has been recognized since the end of December last year and lasted until now. And so far, you already know 215 countries in over the world and including territory identify cases of COVID-19. So firstly, I would like to give you some figure on COVID-19 situation in Vietnam. You know that the first case of COVID-19 in my country was identified on 23rd January 2020. And so far there was 369 cases detected. And also there is no deaths in Vietnam. Among them, so far at this moment, there are 347 cases was discharged from hospital. And now we have only 22 cases still in hospital. And now in Vietnam, we have 85 days without new case in Vietnam. So even that we understood Vietnam was high risk as being vulnerable to the outbreak because there are many things. First thing, we have limited resources. We have large population with density populated urban areas. And also we have long land border with the country of the outbreak of COVID-19. And also we have high volume of travelers to Vietnam, especially during the end of the last year and also at the beginning of this year, because at that time we have holidays and we have many festivals in my country. We recognize that Vietnam will be one of the worst affected country if COVID-19 pandemic was not controlled. So Vietnam government has decided to apply on activities to control COVID-19 one step forward. We, with the spirit, and we use slogan, fighting COVID-19 is like fighting enemy. So in order to fight with pandemic, Vietnam government involved a whole system, including politically and administratively. The system led by our Prime Minister has been activated since the beginning of January 2020. So we use many strategy and activities. So because of the time constraint, we just share with you some strategy already applied in Vietnam. First thing, in Vietnam, we established the National Steering Committee. I think that National Steering Committee is very important in order to combat pandemic in Vietnam. So within National Steering Committee, there are a lot of composition, there are a lot of representatives from different ministries. For example, Ministry of Health, Ministry of Military, Ministry of Police, Ministry of Transportation. So we have 14 ministries involving in National Steering Committee. With the steering committee, they call a meeting every 2 days for a meeting. So during the meeting, we analyze a situation of pandemic in over the world, and we discuss measure in order to deal with situation in Vietnam. So I think that during the meeting, there are a lot of solution has been discussed and made decision. The second one, we applied prevention and early response very strictly. You know, at the beginning of the pandemic, we already contacted with WHO and national focal point for IHR to update situation of COVID-19 in outbreak country, and we applied to many measures for control of spreading through border. At point of entry, we apply strict screening at every point of entry to prevent the importation of the virus. You know that Vietnam was the first country to implement electronic health declaration. We use and we apply health declaration very early, even that at that time, WHO did not recommendation for any screening at point of entry. So early detection by aggressive contact tracing, not only to close contact, but also apply to second and third tier close contact. We use tests for every people who return from overseas and who enter to Vietnam. So 100% of people, they enter to Vietnam during that time, and recently they are tested, and also they are put in isolate, central isolate for 14 days. You know, during the intense transmission of the virus, that means at the beginning of the epidemic, during the early of January and February, we apply social distancing and enforcing people to wear the mask at public venues. And we use even that WHO is not recommended. And also we use hand sanitizer at entry in public areas, and also close school and public event cancellation. And then when epidemic is increasing, we apply travel ban for all foreigners travel, and also apply 14 days quarantine for all people who come to Vietnam, you know, and now we still apply this strategy to limit it and to prevent transmission of virus from outside to my country. By that, we limited many suspicious or cases from outside Vietnam. One of other measure, and I think that that is very important in my country during last time, that is the contact tracing for all contact people in flights. You know that many flights from overseas to Vietnam, and also on this flight, there are a lot of positive COVID-19 people. And then when they already came to Vietnam, and by testing, we found that they are positive. So that by that, we have to return to contact tracing those people. So I think this is very very difficult task. However, that is very important, very, very important to identify close contact with the case. So by that, we do many very successful in order to avoid spreading of virus through the country. Other strategy we apply in my country, that is communication. You know that for communication in Vietnam, we use many channels. For example, for TV, for newspaper, for radio, for telephone, and many other challenges. And you know that one of the most important thing for communication is a very timely, early, timely, precisely, and very transparency. You know that for message through the phone, so far we got more than 9 billion messages to people from the beginning of this year, 2020. Other measure that is apply IT, informatic technology in prevention and control of COVID-19. You know that we use many application for detection and for warning people they got close contact with suspicious case. For example, we use application nCoV, nCoV instead for new coronavirus application. By using this application, many people they can access and declare their information, their situation of their health, and then at once our health worker can get timely information of those people. Other application is Blue Zone. Blue Zone, we use this technology from Bluetooth with cell phone. So now they are applying in my country. One of the strategy that is we apply from the first stage of the outbreak in my country, that is mobilized and utilized on local resources. In Vietnam, we use 4 local things. First thing, we use local leadership. The second one, local human resources. The third one, local equipment and supply. And the fourth, that is a local logistic. So we mostly use local resources for dealing with COVID-19 in Vietnam. Lastly, in order to combat to COVID-19, we acted with the spirit that is no one was left behind. And the slogan we use from beginning to now is that fighting with this pandemic is like fighting enemy. So by that, on people join hand with our government in doing many measures to control and to fight with COVID-19. So we think that in order to have a good result, like at this moment in my country, we have many previously experienced in communicable disease combating, so they can help us in having good results. You know that in 2003, Vietnam faces with severe acute respiratory syndrome. At that time, Vietnam was also the first country to successful control of SARS by doing many activities and measures to fight against SARS. We had certainly experience in order to deal with other outbreaks of communicable disease and public health events like previously influenza H1N1, MERS-CoV in 2015, and most recently that is COVID-19. However, I think that even we got many good results, however, we face with several challenges. For example, you know, a situation of pandemic in over the world is now still increasing. So Vietnam is one among affected country with high risk country. Other challenges, that is a limit of resources, for example, for health resources or test kits. So I think that we try to do our best to control COVID-19 in Vietnam. By that, so far we are 85 days without new cases in Vietnam. So we try to apply strictly measure we have been applying recently. So that is some key point we would like to share with you. And if you have any more question, I'm willing to share with you. So thank you very much for your attention.
Thank you very much, Director General. Now I would like to turn the mic to our last but not least speaker, Mr. Hansbeck. Mr. Hansbeck, you have the floor.
Good afternoon, good evening, colleagues, ladies and gentlemen. Let me say all protocol observed. Can I have the presentation, please? And if you can move to slide number 4. The 7 minutes seems to be very challenging for everybody. I think I might have the same problem.
Dạ, thưa anh, thưa anh, em học trực tiếp.
I will briefly tell you something about the situation in the Netherlands and a few slides on the international context. I don't think we have the presentation there.
Is this the correct slide, Mr. Beck?
I don't see any slides now.
Oh, 1 second. Let us fix it first.
There we go. Thank you very much. So as you can see, the situation in the Netherlands at the moment is that we have had over 50,000 cases. So that's very different from some of your countries. Over 6,000 people have died of COVID-19. These are only the registered cases. The excess mortality is more in the range of 10 to 12,000 people. Next slide, please. Our response is of course, organized like in most of the countries at different levels. Within a crisis like this, it's of course the Ministry of Health who is in charge, but most of the control implementation is done at the regional level through the municipal health services. These are our organizations that cover around 500,000 to 1 million people. And from there, all the activities are coordinated. Next slide, please. In a crisis like this, the outbreak management team is key. So there's a national, that's the science group. Sorry for the Dutch slide here, but the science group, the outbreak management team, advises the government, the administrative coordination committee, on what are the important measures to take to control the epidemic. And that administrative committee decides then what to advise to the government. In the beginning, it is mostly based on the public health aspects only, the health aspects that are there, the care that is needed for the patients. But in due course, this became a much broader advice. Also the social, psychological, and economic aspects were taken in consideration at that time. Next, please. This shows how the pandemic or the epidemic in the Netherlands proceeded. We had many cases in March, April, and many measures were implemented, and then the control started to kick in. And now we have very low levels, but it's not gone. So we still have every now and then small clusters arising, and that's why we have a very different strategy now. Next, please. What we did in previous outbreaks, it was always possible to contain the outbreak through the testing, through the contact tracing, with isolation and quarantine measures. So with all other infectious diseases, this was not a major problem. So with this COVID-19, which is totally new, of course, and we still have very little knowledge all over the world, the whole of Europe, I can say, was taken by surprise by the explosive spread of the pandemic and the seriousness of the presentation of the disease in many people. So the main worry was the overwhelming effect on the healthcare system, and all measures were taken to make sure that we could slow down the spread of the infection and maintain the possibility of providing the right care to the people. So to flatten the curve, that's of course the international term for that. In our case, we were taken by surprise because we're always in a delayed situation, that when people start being admitted to the hospital, that is because they got infected, of course, 2 weeks in advance, more or less. And in Holland, we had many people that took an early year holiday, like going for winter holidays, where already COVID was spreading unnoticed. At the beginning of the year, we also had our carnival festivities in the Netherlands, big public gatherings, a lot of social interaction, and without noticing, a lot of the spread must have been taking place there, which only rose to the surface a few weeks later. Another issue was that as being a well-developed country and having all our emergency preparedness in place, being prepared for such a big outbreak turned out to be very challenging. So for this, we were not prepared enough. Our capacity of supplies, personal protective equipment, the medical supplies, the IC capacity wasn't enough, etc. And only the massive outbreak in northern Italy that opened the eyes of all the other countries in Europe, I think. So the measures that we took were mostly, were called like an intelligent lockdown. And that was based with all the measures that all the other countries took as well. But we focused very much on the civil responsibility, on the responsibility of people, that this is something that we all need to do together, and that is the responsibility of people to make sure that we protect ourselves and that we protect others. Next, please. We had to do all these measures with 100% of action and 50% of the knowledge. So a lot of it was guesswork. I mentioned that this preparedness was really a challenge. Another challenge was that we had these, the spread within the country was very irregular. There were some very hotspots where there was massive spreading and others where there was hardly any. But all the measures that were taken were generic countrywide. So it was very difficult to maintain the support of the people throughout the country in sticking to all kinds of measures that were not really applicable in one area or the other. That's something to learn from. By focusing very much on maintaining the appropriate care for the sick, we might have neglected or were not able to spend the attention needed for especially the elderly in the nursing homes, and we had outbreaks there that could have been avoided with more strict and earlier measures over there. What we have seen as well in Europe, and I think it's might be similar in your area, is that every country was trying to manage this crisis on its own and implementing measures that were applicable to their country, but not coordinating well enough with the neighboring countries. And so, especially in border areas, you had people that were supposed to maintain one measure in this side of the border, and on the other side of the border were different measures that were more lenient or more strict. And that was very difficult in especially that areas. Within Europe, we have also a problem with labor migration. There's a lot of international labor that works in certain economic sectors in different countries. Many people from Eastern Europe work in the Western Europe countries in different industries, especially in the meat processing industry, for example, where there's also these cold areas where the virus is very comfortable. So we had big outbreaks in that kind of sectors, but also with maintaining control on that international workforce. that was cross-border crossing from one area to the other. Another challenge, which is not on this slide yet, is that we also faced the overwhelming need of care in our hospitals and by our healthcare providers, that a lot of regular care could not be given, and that was postponed. But it was also avoided by people that were afraid of COVID infection, so avoided going to hospitals or to physicians to get the care that they needed. So it's a very high burden on the healthcare system right now with low COVID to catch up again with all the care that wasn't provided in the previous months. Next, please. Next. And one more in Dutch, sorry. The next one is a summary of that. At the moment, our strategy is to make sure that we contain the virus as much as possible and prevent and contain local outbreaks. We do that through massive testing. We have testing facilities all over the countries. We're testing now, or we're trying, we have the capacity to test at least 30,000 people a day in the country of the Netherlands. That's enormous. We can even scale up to 70,000. And of course, we are still trying to maintain the care for all the people. That's especially necessary when we are expecting a second wave. The early warning systems are now much better in place with all the testing and all the surveillance systems that we have. Also, you mentioned already the use of IT facilities like apps and so on. One of the other surveillance measures that we have now, which is also new and developing, is testing of sewage systems and to see if there's any spread of the virus that was previously unnoticed. Next, please. I'm not so well placed to talk more about the international cooperation and so on. Within Europe, I mentioned already that the coordination of measures can be improved in future. We have, of course, a very important role within Europe of international surveillance, international information sharing, international guidelines. That's all working very well. But the coordination of doing the right thing at the right time all together is still a challenge. WHO has taken its role, especially I think by advocating for support for the less developed countries and the fears that we have that the pandemic might be much having more impact in less developed countries that also will affect the more developed countries, of course. This morning I heard on the news that there is a committee now that will evaluate the handling of the epidemic by WHO and see what we can learn for the future from that. For the ASEAN community, I know that the European Union has all kinds of bilateral agreements with many of the countries that you represent. The special relations between some European countries and some Asian countries, like, for example, from the Netherlands with Indonesia. Next, please. So for the future, this last slide, the early detection of our outbreaks, I think that's the main important thing that we need to look out now. It is still there. We still have massive outbreaks in areas of the world. Where it is under control, it can easily be flaming up again. So that's a very important aspect, that we all have our international health regulations in place and that we notify each other of possible problems arising again. The impact on the countries from the epidemic is, like was mentioned before, not only a health issue, but also a social issue and an economic issue. But making sure that all the health systems can cope with new outbreaks is very important. That's why we need international support. But for the long run, in preventing outbreak like this, I think it was also mentioned already in a previous presentation, we need to redefine how we organize the world, how we organize our, especially our agriculture and our food processing, all the international movement of food and animals seems to be very challenging for outbreaks like this. The international efforts to develop vaccines and to make sure that they are accessible for all and very affordable for all is of course an international responsibility that we all have, where we need to work together as much as possible. I think I leave it at that for now. I'm sure the 7 minutes have passed by now. So thank you very much.
Thank you very much, Mr. Beck, distinguished participant, Excellency. If you look at our time, actually, this is the it's already 12:30. So actually, panel discussion one should be finished by now. But if I would like to ask for probably about 3 to 5 minutes from the session 2 to have some question and answer. And I have one question from the for the DSG, I'm sorry, Excellency Mr. Kung Pak. And this is the question from we got it from the internet from Johannes. He's asking, does ASEAN have cooperation to prevent the member states from economic crisis affected by COVID-19? I believe this is the question, and I give the floor to His Excellency. You have the floor, sir.
Thank you very much for the questions. As I mentioned in my brief interventions, that we are now working on the recovery framework, and we are going to have a range of meetings discussing about ways and how member states can help one another, to emerge from this pandemic. Of course, we acknowledge that the road to recovery is going to be a very difficult one. And that's why we have to, take into account all aspects of the recovery. It's not just about the economic, and all the speakers also mentioned about the numbers of issues that are important, when we putting in place, the recovery plan. And of course, I think we are working very closely in coming up with a plan so that, all member states, will be able to emerge stronger from this crisis. And that requires, strong solidarities and partnership, and also a strong coordinations, not just the policy at the regional level, but also at the national levels as well. Because what will be happening in one member state, we also have implications in other states as well. For example, travel restrictions, the flows of goods across border, and so on. So all of this will be discussed. I can't say much as of now, because it's still an early stage that we are going to, discuss about the recovery plan. But we are taking into account that, all member states will support one another. We cannot leave anyone behind in this crisis. The reason that, ASEAN is resilient is because, we take into account the challenges of all the members. We acknowledge the different levels of development, and that's the reason why, when we are enacting a plan, it should, reflect all the different levels of developments, and also the challenges, and how member states can support one another in going, through this crisis together. So that's a brief answer I can give as of now, and I'm sure in the coming weeks and months we will see a comprehensive recovery plan, coming out of the ASEAN, for the world to see. Thank you.
Thank you very much, His Excellency. Now I would like to, I see here we have several other questions. I have two questions from for Mr. Hans Beck. And this is relating to, first of all, the first question is about, this is from Sharif. He would like to ask, whether why the Netherlands doesn't publish people recovered from COVID-19 in daily report. That's the first question. Second one is from Arvin. This is from Philippines, and he asking Mr. Beck. This is about herd immunity, and the question is, since REVM launched a study on herd immunity, do you share the idea of herd immunity as practice in European country? And if yes, can you make a comment about the medical journal from Spain or any other or Netherlands or any other country that is embracing the idea of herd immunity? Mr. Beck, you have the
Yes,
floor.
thank you. Thank you for the question. On our monitoring systems, we have many indicators, and the recovery of COVID is one of them. I didn't present it in my presentation, but we have figures of that as well. Can you hear me?
Yes, yes.
Okay, thank you. On the issue of herd immunity, that was initially, of course, a strategy that we hope to achieve by having the epidemic crossing our country in a slowly and controlled manner. But I think that strategy is left behind. At the moment, antibody levels that are tested under blood donors or other groups are very, very low in the Netherlands still. I think we have between 3 and 5% of people having antibodies, and we still have very little knowledge on the level of immunity. How much immunity does it provide? Are the antibodies that are detected, are they protective? How long will immunity last? So the strategy of having herd immunity without the availability of a vaccine has been left behind, I think, in most countries now.
Okay, Mr. Beck, thank you very much. I have also a question for, this is for Dr. Jamila and also for Director General Dang Quan Tan. This is related to the, in your opinion, how can actually ASEAN and the Netherlands in this context, or EU can have cooperation not only in terms of policy but also in terms of more concrete things, and we would like to know your opinion on this, and related also to what has been mentioned before, because some of you, I think Dr. Jamila also mentioned about the vaccines, development of vaccines besides the Excellency Kung Pao, and this is related to the development of vaccines. Is there how is the cooperation between ASEAN and EU in terms of the sharing of not only knowledge but also in terms of come out with the access to the vaccine itself? Thank you very much. Dr. Jamila, I give you the floor first.
Thank you very much. I think that's a really important question. Before I answer that, just to add on to what was said about herd immunity, I think one of the things we all have to acknowledge is COVID-19 has taught us a great lesson in humility. You know, a lot of the times we think we know how to deal with it, and then the next thing you know, it behaves differently. So even now, you know, WHO is struggling because, you know, scientists are challenging them, you know, on the airborne nature of the virus. Then that's going to really be a game changer, because how do you then, you know, kickstart the tourism industry, for example? You know, how do you manage flights, whether it's domestic or international? So these are big implications. So I think, you know, the big lesson is we really need to be humble. We're really dealing with something that is so complex and uncertain. The second is that, right now, one of the good things I think that has happened is that, WHO and others have managed to bring a lot of the developed world together in looking at, a collaborative approach to vaccine research and production. And with the COVAX facility that has been established, I think we need to also kind of mimic that as well. Where I think Netherlands has great value to ASEAN is you're very advanced in your health research, you're very advanced in innovation. So it's not just for now, for the COVID management now, but also looking at the future. We're talking about basic things. We tell people to wash their hands with soap and water, and yet there are many places in ASEAN there is no soap and water. How do we better improve water management? And this is something that the Netherlands is so advanced in, and we can learn. How do we make sure that water sanitation and hygiene is a part of our social justice? Everyone should have access to that. The other thing, of course, is, as I mentioned before, how do we make sure that the monopoly of vaccine production does not only remain in the West? How can there be transfer of technology? We know that, for example, China, Korea, Japan, in this region, at least the +3s of ASEAN are very advanced in the biomedical field. Sinovac, for example, has already started stage 3 trials. So how do we bring some of the expertise to the region, and perhaps collaborative? This is why I kept mentioning about an ASEAN Center for Disease Control, not just for analysis and data and so forth, but also in terms of future research, innovation, not just for the vaccine, but also test kits and other things. So I think there's a lot to look forward to in terms of collaboration. And one of the things that I always say is that we are not safe until everyone is safe. And the fact that people traveling can actually possibly bring a virus to a nation also tells us that we have to treat everyone now with a lot of kindness and humanity, that and not accuse anyone, but really work towards a spirit of finding solutions together.
Thank you very much, Dr. Jamila. It's very, very interesting on your reply on this one. I would like to give the floor now to Mr. Director General Dang Wang Tan. You have the microphone, Director General.
Thank you very much for your question. Regarding to your question, I would like to share with you some information in the context of my country. You know that in order to have a good control of COVID-19 in Vietnam, our government has been applying many policy and guidelines. You know that in policy, we apply the slogan, no one was behind. It is mean that all people living in my country has a right to be help to be treated and have a good health care for their health. So regarding to COVID-19 patient who was discovered and identified in my country, 100% of them has been cured, has been treated freely with no just even for foreigners. They discover infected in Vietnam, and the foreigners was bring to hospital for treatment with for freely. And also our government issue several guidance in order to implement policy in my country, and priority was given to people who live in far remote area and in rural areas. Technically, Ministry of Health and other ministries has been developed many guidelines on surveillance, treatments, and also guidelines for testing, something like that. So this guideline has been applying for COVID-19 patient and suspicious cases in Vietnam. For research, as you mentioned in the question, now Vietnam in the process of research, vaccine research for COVID-19 vaccine research, and I think that in the process of study, as soon as we have a good result, I think we can share with you all about our result. And the other area, I would like to inform you that for testing, Vietnam now can produce several kind of test kits for COVID-19. For example, for PCR testing, we can produce in Vietnam, and now we are in process of we are in process of introducing to some country like in some country to have access to this product, and also this product can be used in my country for previous period to detect COVID-19. So I think that for more detail on PCR and quick tests for COVID-19, I think we can share with you. So by that, I think we have a good cooperation. If you pay attention on what Vietnam has experienced on COVID-19, we can share with you in more detail. So that is some feedback from Vietnam I can share with you. Thank you again, and if you have any more question, I am willing to share with you. Thank you.
Thank you very much, Mr. Director General. I just informed by my colleague here that Dr. Jamila is needed in an important message, and she will be leaving our discussion. So it means that she unfortunately she will not be joining in the panel discussion too. I still have one more question to Mr. Dr. Jamila. You still here? I thought you already left the.
I managed to push my meeting a little bit, so I can stay for another 30 minutes.
30 minutes, okay. We would like you to be in a panel discussion too.
Yes,
so
yes.
I will make sure this will be last question to Mr. Secretary General, Pak Oscar. Do we have? Mr. Kung Pao, His Excellency, please, you have the floor.
Thank you very much. Just add to what colleagues, just provided answer to the questions on potential area that ASEAN and EU and the Netherlands in particular, can work together. Beside contributing to the response funds or contributing to the regional stockpile, Of course, there are also other ways that we can work together as in concrete ways as well. Probably I start by also updating the meetings as well, that through our cooperations, which is called Horizon 2020, the EU is also funding 18 projects, which is research project that looks at, vaccine diagnostic and therapeutic and so on. That will be the collaboration between research institution in the region and research institution in the European Union. So that's one example of how we can collaborate. And of course, two of our member states are also working on vaccine, which are Thailand and Singapore. And I expect that the capacities in this area will improve in the future. Just to also add a little bit more on another potential area, which is, we are now working on the feasibility studies, the establishment of the ASEAN Center for Public Health Emergency. So there's a lot of things over there, the capacity building, treatment, laboratory, research, innovations, the use of technologies and so on. So that's also a major potential area that we can work together. Finally, I just want to echo, what Dr. Jamila and also DG from Vietnam just said. There are simple things that we assume people can do, but for some people they cannot. For example, sanitation and things like that. I think we should also, put more emphasis on this and support more of our people. Thank you.
Thank you very much, His Excellency. I have question to Mr. Secretary General. This is from Ron Holzhake. How can we facilitate the process of doctor and epidemiologists dealing with COVID-19 to learn and exchange best practices in the treatment and containment of the outbreak across ASEAN, taking into account the particular condition of the region and health resources available in the region? Mr. Secretary General, you have the microphone.
Yes, thank you. Thank you for your question. Yeah, regarding cooperation on information sharing, ASEAN and Netherlands and Europe, EU can organize information and technical exchange through the ASEAN Emergency Operation Center Network knowledge sharing platform, which had been utilized in facilitating exchange through video conferences, Italy and France. The platform brings together Asian contact points on public health preparedness and response, including Asian network on diseases surveillance, field epidemiology, public health laboratory, risk assessment, and risk communication, including disaster health management. I think this is our answer.
Thank you very much, Mr. Secretary General. I still would like to have one more question to Her Excellency Ambassador Aksiri, and this is related to the how we can minimize the disruption to economic. As one of the country in ASEAN, and I think it is applicable to everybody, how can ASEAN or a country in this case context maintain the free, fair, and open open trade policy? During this COVID-19, because this is also the things that is needed for all the country that they need to restart their to restart their economy. Ambassador Aksiri, you have the microphone.
Thank you. I think I've mentioned a little bit on this part earlier on. I think by reaffirming our commitment to free and open trade and environment, and the ASEAN has been working on to strengthen ASEAN economic communities and to expedite our efforts to achieve a free trade agreement. These are also, and to also speed up our harmonizations of rules and regulations to facilitate cross-border trades and to support for free and open multilateral trading system. These also are the areas that ASEAN can work together collectively. And for each own countries, that we have our own domestic policies that we are doing. Another way that we are calling upon for ASEAN countries that we could also work on is to ensure multi-dimensional connectivities in the region and beyond, because multi-dimensional connectivities will support and ensure that the strengthening of regional supply chain that is not just only in terms of improve and strengthen high quality and green infrastructure, but also to strengthen what I've mentioned earlier as well, the digital infrastructure, which proved to be a necessity in this post-COVID era. And another area that I've mentioned is the area of food and agriculture, and water resource management, the areas of healthcare. These are the areas that ASEAN have resiliency and have strength that can improve and can work more closer together. Thank you.
Thank you very much, Ambassador. We come to the end of the session one. Just would like to give about a very short conclusion from my side. I think we already heard all of the distinguished speakers, and from the question and answer also, we can conclude that the COVID-19 is if I can use words by Dr. Camilla, this is wake-up call for everybody, every country, every nations, and it needs a multi-stakeholder and also multi-dimensional approach to deal with this. And when we look at this issue, it is not only focused on how can we deal with the impact at the moment, but also how can we in the future mitigate such problem or pandemic if it is arises. And in this context, all of this fact actually highlighting once again the importance of multilateral approach. Everybody needs to be chip in on this issue. How can we deal with this? It's not no country, no region can only deal it alone. We need everybody on this one. And ASEAN is as one of the organization is already doing in accordance to that, and we are very happy that the next steps is now how to deal with the dealing with the access to vaccines and better health framework in the future. So with that, I would like to close the session. A very big applause to all the presenters and all the participants. Now I would like to give the floor to my colleague, Anna, who will be moderating the second session. Please allow us here for a minute to 2 minutes of administrative arrangement. Please stay tuned. This actually, the webinar is already participant applying is around 280. At the moment, we still have half of it, 125 at the moment. So this is a very good condition. So with that, I would like to give the microphone to my co-moderator, Madam Anna. Lagi ulang.
Okay. A little technical issue here. Technology illiterate myself, shame to admit. in the interest of time, I usually enjoy spotlight, but because we have limited of time, so we're just gonna go ahead with the second session. And the understanding that Dr. Jamila will be the first speaker, and I believe that we need no further introduction for Dr. Jamila. But we would like you to highlight on the specificity dimension of the COVID-19 phenomena in the world, especially when we are talking about or emphasizing the needs of leaving no one behind, because we know that the impact of the pandemic has been it has impacted on everyone. It has affected everyone, but unfortunately, to some of us, the impact has been disproportionate. So I think it will be very interesting to take advantage from Dr. Jamila's extensive experience on the humanitarian side of work to highlight on this humanitarian dimension of the COVID-19 phenomena in the world. Dr. Jamila, please, the floor is yours again.
Thank you very much, Anna. I think that if you look at the multidimensional impact of COVID-19, we can look at it from the perspective of the disease itself and the after effects or related impacts of the disease. So what I mean is, for example, if you look at in terms of vulnerabilities, we know who are the vulnerable groups. They're basically the people who are older, who have comorbidities, who are probably having lower socioeconomic status, and as well, because that puts them at higher risk of other medical conditions. But what we do know in this COVID-19 as well, we're seeing that even younger populations are impacted because, in some countries, for example, they don't seem to be able to, do enough testing and also practice what we call the next norms or the transitional norms that we all have to do now, wearing a mask and so on and so forth. So that's one aspect of it. Of course, we have still many countries undergoing, very severe, risks of climate change, and so you will have, colliding threats at the same time. So you have. When you have displacement, for example, people are living, very close to each other in cramped surroundings, urban slums. These are all very, high-risk groups. It's easy for us to talk about social distancing, as mentioned before, but in some places, when you are living, 20 people in a small household, how do you contain disease in those circumstances? So it's really the underpinning. Why the Sustainable Development Goals are so important is because the underpinning factors are all contributing to risk and vulnerability. The other thing, of course, is that we have emerging disease in some regions. For example, in Africa, the rise in number of cases in Africa is actually quite fast now and high. So here's a region that we don't have, that may not have enough in terms of means to do testing, wide testing, isolating treatment. How do you, in countries or places where there's not even enough hospitals, how do you then have designated hospitals for COVID-19? How do you make sure that, there are enough personal protection equipment? Because if the frontliners who are extremely high risk don't have that, and then it puts everyone at risk, because who's going to take care of patients? So these are the direct impact of COVID. But the indirect ones, of course, is that with the economic impact right now, it's so difficult for even people who are in the middle income group now moving to lower income group, and therefore there's going to be disproportionate distribution of wealth, right? Increasingly disproportionate distribution of wealth. So, someone might not die of COVID-19, but because they don't have access to healthcare, they could, have a higher risk of, morbidity and mortality from even non-communicable diseases, and so on and so forth. So I think that, we have yet to see the worst, according to the World Health Organization. things are unfolding in many parts of the world. In countries where we think they've won the battle, suddenly they have a re-emergence. So, you know, how do we then, there was a very interesting question, how do you then, in the chat to say, when countries don't have a rich economy, how do you persuade people to, you know, practice social distancing or put on a mask or not go out when, you know, they depend on, you know, going out, small businesses and so forth, they're eating, you know, hand to mouth existences, right? I think this is where government social safety nets must be strengthened, and social protection is going to be very, very key.
Thank you so much, Dr. Jamila. Very insightful indeed, and very stimulating, I think, for the participants to further elaborate with their questions. And I'm sorry, but I have to inform all participants that we're going to have a little adjustment with regard to the speakers. Now we are moving on to Dr. Dia Saminarsi, the Senior Advisor on Gender and Youth for the DG of WHO. And if I may just highlight her excellent curriculum vitae, Dr. Dia Saminarsi, with a psychological science background for her educational background. She used to serve as the special advisor for Minister of Health of Indonesia in Partnership and Sustainable Development Goals from 2014 to 2018. And now she's serving as the Senior Advisor on Gender and Youth for the Director General of the WHO. And of course, I have a very excellent portfolio here about you, Mbak Dia, in my hands. But in the interest of time, I'm just going to give over the floor to you. Mbak Dia, please.
Thank you, Mana. Good afternoon, Excellencies, and good evening, colleagues, and joining in from different time zones. Greetings to everyone from Geneva. It was such an honor for me to be invited here and to speak and present a perspective of social impact perspective on the pandemic and the current situation from the global level, and to present context similar to that of ASEAN countries, and also SDG implications, and then provide a few recommendations that perhaps will be useful for us all as takeaway points. So I would like to start, request the slides, please, colleagues in Den Haag. First slide, please.
Can everyone see the slide now?
Yes, I can see it perfectly. Yeah. Next slide, please. First one. Okay, so as an overview, this is a data from the 7th of July at 10 Geneva time. Now we have, I believe, close to 12 million new cases, deaths new deaths from 88 countries, 500. Almost more than 500,000 deaths already in 186 countries, and rapidly growing number of new confirmed cases. Next slide, please. These are the world in which we live now. We have, as you can see, all of the regions, WHO regions. There are 6: Africa, Americas, Eastern Mediterranean, Europe, Southeast Asia, and Western Pacific. All but Europe region are showing rapid increase in number of confirmed cases. So if you have been following the Director General's twice weekly now, or previously three times a week press briefing, he has been repeating the message that this pandemic is accelerating in speed in every part of the world but the European region. So you can see that statement reflected in this graph. Next slide. The number of COVID cases by age and sex for selected indicators, so asymptomatic cases, deaths, hospital admissions, ICU admission, and ventilation. You can see we have been receiving that number of men are significantly higher than number of women in each of these indicators. However, we are cleaning up the data regularly and analyzing this situation closely to see and look beyond the numbers. What are the message actually in this from that we can get from these indicators? Is it access? Problem with access for women? Is it under detection of new cases or other reasons? Next slide. To investigate and analyze better, we have, if you go into our website, then we have so many technical guidelines that keep on being updated daily. But also in parallel, we are convening many different groups to visit closely the many different issues that we are facing. I'm talking about not only the disease itself, but also the social determinants aspect of things. This I would like to highlight the draft high-level WHO evidence briefing, which is a joint product of the social determinants of health department, the gender equity and rights networks, with data and emergencies department at the University College London. There are actually 10 different key elements that are written on this draft high-level evidence briefing. However, it reflects or it sounds here with ASEAN countries. One, I would like to start from the broad finding. So pandemic and containment response have exposed and will potentially exacerbate social inequalities or inequities in health. There are three impacts. So if you see the graphs, the blue one is the high social economic status, orange one is the middle, and gray one is, the gray line is the low socioeconomic status group. Impact one is looking at the morbidity and mortality due to COVID-19. Impact two, looking at morbidity, mortality from health system inability to provide services to other conditions. This is, I believe, I observed this from Dr. Jamila's points earlier. Impact three is morbidity and mortality by recession and advanced determinants, such as increased poverty, and then unemployment and food insecurity, and so on and so forth. So if you see the blue and the orange and the gray line, those gaps show widening health.
But yeah, we're losing you.
And that was existent before, but now it exposed it even further. Next slide. I draw now an example, another example, impact on the occupation and also gender. This is an example from England and Wales, where men working in the lowest skilled occupation have the highest rate of death involving COVID-19. Men and women working in social care both significantly raise rates of death involving COVID-19. So if we take this example and we reflect it into what is going on in ASEAN countries, you will find similarity that those working in lower skilled occupations have higher risk of death due to COVID-19. Slide, next slide. Another one is impact on housing and crowding. As you are well aware, ASEAN countries consist of very densely populated areas, cities, public spaces, slums, and of course also refugee camps, where access to water and sanitation, living hygiene are not available, and also people living in incarceration in psychiatric institutions and nursing homes and other institutions which are crowded or dense. This also impact on the COVID, have impact on the COVID mitigation. Next slide. On remoteness and access, so ASEAN countries again, I think we can draw, even though this is an example from the USA rural Navajo Nation and Torres Strait Islands, we can draw that these geographically remote places are also do also exist in ASEAN countries.
Mbak Dia, Mbak Dia, Mbak Dia. Hello, Mbak Dia. Hello, Mbak Dia. Do we still have you? Hello, Mbak Dia. Mbak Dia, hello.
Status and also gender and language barrier and literacy.
Mbak Dia, I'm sorry, I have to interrupt for a moment. I think we're having some problem with your connectivity. Mbak Dia. Mbak Dia, hello. Hello, Mbak Dia. Hello, Mbak Dia.
Yes, can you hear me now?
Now we can hear you clearly.
Okay.
But before you moving on, I'm sorry to remind you that you're gonna need 3 more minutes to wrap up the presentation.
Okay.
Right. Thank you, Mbak Dia.
Yes. You. So let's jump into the. I left off at the remote and access. This one, as I highlighted before, we have barriers to access of internet, information, socioeconomic status, and gender, and language and literacy barrier. So what should we do? Please jump into slide 12. So if you quantify, next slide. If you quantify all those barriers, the slide before, please. If you quantify this, all those barriers, then actually it speaks to estimated 1.5 trillion US dollars of what it entails, what the pandemic entails of violence against women and girls in COVID-19. So that alone is the number that can be quantified from impact of pandemic against women and girls. Next slide. Now, what is the WHO doing to mitigate these challenges? One, you can find this 2 technical guidelines, the COVID strategy, monitoring and evaluation framework in our website, which detail what we expect, what we ask countries to do, down to the communities and subnational level to mitigate the pandemic. And the next slide, there are also detailed or topic-specific guidelines that are available in WHO and is being published and renewed daily, where it concerns COVID or pandemic mitigation in essential health services, how to mitigate against violence against women and children, based on how to intervene. The framework is how to intervene, analyze, and then measure. So this is actually the framework that we implore countries to do based on the technical guidelines that are published in our website, in WHO website. The next slide. We are talking also about the SDGs. When SDGs were first there, we of course did not expect a pandemic to happen and to be experienced globally. The upcoming high-level political forum for the SDGs is being set up with the focus on building back better and specifically target and discuss the UN-wide response on these key elements, which the UN system believe, based on inputs from member states, that if these elements are being handled, are mitigated, then the building back better, the next world will become better. Next slide. The question now is how to build back better. What are the principles that we have to live by or use when we try to build back the pandemic after mitigation, and how do we build back the future? This is one example that I draw, which is applying principles of futures thinking. And these are the steps where we ask member states to consider doing as the world is trying to build back and to mitigate the challenges of a pandemic. With the focus of the center of building back is based on gender equity, equity for a vulnerable population, and based on the increasing rate of gender-based violence that we are experiencing today. I will skip the country experiences. These slides are, you are welcome to have it. The organizing committee will distribute that to you if you are interested. Just jump on to slide 19. Yes, thank you. So what do we learn from the pandemic that we are experiencing today? One, global health has been transformed. We are now, we know now that we are interconnected. And COVID has shown us the cracks in our societies. There is question of equity that we need to address. Responses need to transcend mitigation, but also beyond mitigation, we need to think about sustainability. And we need to think, of course, beyond the disease itself, beyond COVID. We also learned that the community engagement and social media strong role in emergency situation. How do we use that as the modalities from countries level until the global level, and emerging new types of community, like what we have today. Virtual community is something that emerged out of the pandemic, and new vulnerable groups also emerged out of the COVID-19. So before, perhaps it's there, but lying under the surface, but now it's exposed because of the pandemic. Next slide. And as we build the new normal, the dimensions of the new normal, one, we know now that health matters. It redefines the way we live and the way we behave. We need new social contract which emerge where individual becomes a global, individual health becomes global public good. And society becomes increasingly polarized and fragmented. And as a result, as an impact of this, then it gives exposure to greater inequalities and new vulnerable groups. Communities to continue to live with constant stress, uncertainty, and pressure during loss of jobs and pay. Next slide. Just jump into slide 22. What are the recommended actions for governments? I draw this from the UNSG report and recommendation, and we ask the government to allocate additional resource, include evidence-based measure in policy making, strengthen the services for women who experience violence during COVID, build capacity, so continue to increase capacity of community groups up to national level group to prevent impunity and improve quality of response. Due to the exposure of this new vulnerable group, please put women at the center of policy change, solutions, and recovery, and ensure that without data, without good, rigorous, and robust data, we cannot do anything, and there will be no implementable policy that can be done. So ensure sex disaggregated data is collected to understand the impact of COVID-19 on violence against women and children. With that, I would like to end by saying thank you, and would be happy to answer and clarify any other comments that you have. Thank you. Thank you, Mana.
Thank you so much, Mbak Dia, with a very strong 2 points of conclusion. Thank you so very much for that, and of course, a very rich presentation. Next, we're gonna move on with the presentation by Ambassador Leda. Ambassador Jaime Victor Leda is a career diplomat with political service and legal background, and has been serving the Ministry of Foreign Affairs of the Philippines since 1990. Well, that's a very long time of serving experience, Your Excellency. And His Excellency also has a very extensive consular experience in consular service. And he was, if I'm not mistaken, was awarded as well for his achievement in the delivery of consular service. And I believe that this kind of experience will be very useful in terms of repatriating, or the efforts of repatriation of the Filipinos from, especially from the Netherlands or Europe, back to their home country. And without further ado, Ambassador, please, the floor is yours.
Thank you very much, dear colleagues. I'd like to express my appreciation for this invitation to participate and to make a presentation of the Philippine experience. And well, I'd like to greet everyone a good afternoon, and greetings as well to our colleagues at the Embassy of Indonesia, and thanks for coordinating this event. And as well, greetings to my colleagues at the ASEAN Committee in The Hague from the embassies of Thailand, Malaysia, and Vietnam. And thank you also to our esteemed speakers and resource persons from the ASEAN, ASEAN Deputy Secretary General Kong Fak, good afternoon to you, and to the officials of the Ministry of Foreign Affairs of RIBM of the Netherlands, and our distinguished speakers and excellencies from the governments of Malaysia, Indonesia, and Vietnam. Well, the Philippines has its own share of difficulties with the COVID-19. And ever since the World Health Organization characterized COVID-19 as a pandemic, the President of the Philippines, President Duterte, placed the entire country under a state of calamity on March 16, 2020. And in less than 150 days, our lives have changed immensely. And we've experienced many losses. Many Filipinos lost their loved ones. Many have lost jobs and economic opportunities, and a lot of people were affected, leading to a change of lifestyle. And our statistics would show that we have been hit hard, and we continue to struggle with this. The statistics would show that the Philippines has cases that would easily make it in the top 40 of countries in terms of number of infections and also in the number of deaths. But we'd like to also look at the encouraging aspects of these statistics. For example, in terms of recovery, we have 12,813 reported recoveries. So that leaves us with 37,627 active cases so far. In terms of deaths, we have recorded no deaths yesterday, July 9, 2020. So that's the first time since the state of calamity has been declared. Now, we are also monitoring the cases of Filipinos overseas, where we have 8,803 cases in 64 countries and regions. But looking at the statistics, recoveries also show that this is an encouraging development, with 5,265 recovered. So that's about 60% of the cases overseas. And deaths number about 594. Here in the Netherlands, we are relieved to have noted only 3 reported cases of COVID-19 infections, where one resulted in, unfortunately, a death, but 2 reported cases resulted in recovery. So these numbers could have been 3 or 4 times worse if the country did not act quickly or listen to the experts, and if we did not use our resources wisely. And so we have to dig into our potentials and count on everyone to help and protect our country. Now, the national responses shows we have different activities undertaken with the creation of the interagency task force that will coordinate the efforts and actions of relevant agencies. And this task force has 3 priority areas, namely health, response, and capacity building, social amelioration programs, resource management, and strategic communications. I'd like to go into the humanitarian aspect of these programs. We have the provision of social amelioration programs. Our Department of Social Welfare and Development, for example, has the emergency subsidy program, where there is a salary subsidy for 2 months for 18 million Filipinos. Our Department of Labor and Employment provides adjustment measures program. And here, for example, in the Netherlands and in other parts of the world, for our overseas workers, our Department of Labor and Employment has a program called AKAP. I don't know if the word in Bahasa is similar, but AKAP, it means to embrace. I don't know if that's the same in Indonesia or Malaysia for that matter. But we have a program called Dole AKAP, where members who are displaced by COVID-19, members of our overseas welfare program, will be able to receive a one-time financial assistance of $200 US. We have also our Department of Agriculture, which has a survival and recovery assistance program. Our Department of Finance is also assisting our small businesses through wage subsidies. We have also a program for small businesses, such as the Pondo, or the Fund for Renewal and Development. It's an enterprise rehabilitation fund. And of course, we have emergency loans for members of different social security systems. In terms of the resource management strategic communications, there are critical tasks involved here to ensure availability of supplies, resources, and facilities for response operations, identifying quarantine and treatment facilities and locations, as well as formulating economic plans and programs to help cope with the adverse impact of the pandemic. So for the Department of Foreign Affairs, we have, again, as of July 5, 2020, we've been able to repatriate 70,386 Filipinos. This is the combination of land-based and sea-based overseas Filipinos repatriated since February 2020. And we continue to do that until today and until necessary. And if we go back to the statistics that we earlier showed, we see that there have been cases of Filipinos who have returned to our country with the COVID-19. And so there is this, of course, impact of the repatriation effort. And hopefully, again, with the increased capacity of our ports of entry, both international airports and seaports, there will be an opportunity for us to stem or contain the spread of the virus. The Department of Foreign Affairs thus acts as a frontline in providing assistance and solutions, and we in the Philippine Embassy are part of that effort. We facilitated the repatriation of affected overseas Filipinos, and all our embassies and consulates generals are undertaking this. So from the Netherlands, since July 3, we've had at least once weekly flights that have allowed the return of Filipinos. And we hope that this will continue. Of course, there are also charters and other commercial flights that have been operating from different parts of the world, particularly in the Middle East, where we have a large community living and working in that area, in that region. So We've assisted and processed in the facilitation of international humanitarian assistance, particularly from 9 foreign governments and 6 other entities, such as international organizations, private companies, groups, and individuals. Obtaining flight clearances and issuance of visas for foreign technical experts, particularly in the procurement of COVID-19 related resources that have been coursed through the Philippine Red Cross, the Asian Development Bank, to the Department of Health. And of course, through ASEAN, we participated in many discussions and that are aimed towards shaping regional policies that will help address the effects of COVID-19. So here in the embassy specifically, we have been offering various repatriation-related services, and we've also participated in the different social welfare and labor assistance programs that have been launched in the Philippines and that have been applied abroad. Now, since March, we have been arranging repatriation, helping stranded Filipinos, mostly seafarers, but we have also some students, some tourists who have also been affected. And we've been trying to bring home batches of 300 to 400 Filipinos. And we have actually experienced some situations where we had Filipinos stranded at the airport because of canceled flights.
Thank you, Ambassador Leda.
Yes.
Ambassador Leda, could you please wrap up in just 1 minute?
Yes, I'll be ready to do that in a moment. I'd just like to also take this opportunity to express my appreciation to the Filipino community organizations here in the Netherlands for spearheading several initiatives to assist our fellow Filipinos in the spirit of bayanihan, or in Dutch, we call it samhörigheid, or the spirit of community. And we've extended this to many Filipinos throughout the Netherlands. Now, a very important aspect of our efforts have been also the establishment of a green lane for seafarers. And this was done recently with where we opened the first green lane for seafarers in Asia to allow the free movement of seafarers and personnel across borders. And there's been a joint circular, and we need to address the situation of world seafarers without whom there would be no shipping and who would ensure the maintenance of global supply chains. I'd like to now move on how we're looking forward in our engagements with international organizations, especially with our regional partners in ASEAN. And I think some important points that we'd like to, one important point, and we'll make this statement available for our panelists and those who are watching right now. In the recent UN high-level political forum in 2020, NEDA Undersecretary De Leon mentioned that the UN must promote a rule-based international order in providing safeguards so that health goods such as COVID-19, immigration remains a public group, and that we have to find better ways to bolster our many partnerships so that we can continuously strengthen cooperation in overcoming this unprecedented and multidimensional challenge that is COVID-19. I'd like to take this opportunity also to thank our colleagues from the EU in the Philippines. Not so long, I think a few days ago, European envoys got together to donate blood to the Red Cross in a show of solidarity with the Philippines in the fight against COVID-19. And I'd like to mention to Mr. Mark Staden that Ambassador Saskia De Lang was among the EU envoys that joined in this particular effort. So we thank them for this response to the blood donation call to avert a shortage in the Philippines. Let me conclude with a encouraging observation, which our previous speaker, Madam Dia, also cited in her last slide. And I think Secretary Locsin's statement is similar to what was quoted in your last slide. And this is what he said: "We have entered a brave new world in the writer's original sense, a world that will need bravery to survive, courage to dare, and above all, trust among everyone to prevail." And I believe with ASEAN and our partners in the international community, like the Kingdom of the Netherlands and the European Union, we will prevail. And I'd like to wish everyone to keep safe and keep healthy. Thank you very much.
Thank you so very much, Ambassador Leda, and especially with that particular humanitarian aspect and dimension of the COVID-19 mitigation. And also, I think a lot of countries, both in ASEAN and also in the European Union, can relate so much with the issue of how we're going to ensure a safe and dignified repatriation for all of our nationals in many parts of the world. And the next speaker, we're going to have Director General of the Department of International Organizations, the Ministry of Foreign Affairs of Vietnam. And if I may say, a dear friend of me and Pak Fikri back in our old day in New York. I'm sorry, I have to drop that. And DG Do Hong Viet is currently Director General, as I said, at the Department of International Organizations, Ministry of Foreign Affairs of Vietnam, since July 2019. And he currently manages the task force for Vietnam's membership in the United Nations Security Council until 2021. And he also served as a special assistant to the APEC chair of the senior officials meeting in 2017. And prior to that, between 2013 and 2016, DG Viet served as the Deputy Permanent Representative of Vietnam to the United Nations. And his portfolio, ding, 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 the humanitarian and development and human rights aspects. And also peacekeeping. I'm sorry, I left that out. And also peacekeeping and Security Council affairs. And with that, DG Viet, the floor is yours.
Thank you very much, Anna, and thank you for the introduction, even though I thought it was a little bit too long. And I thank you to all the organizers for this great initiative to bring us together, even though only virtually, but to discuss and share experience on this extremely important topic. I bring you, of course, very special greetings from Hanoi, Vietnam, where over the past 85 days, we have not seen, fortunately, any new local transmitted cases. And as we continue to help repatriate Vietnamese citizens from abroad, from around the world, from the EU countries, as well as from America, Canada, and some other Asian and Southeast Asian countries. We are, as Dr. Tan mentioned earlier, we are quite pleased that we have not had any fatality yet so far, and about over 90% of positive cases have recovered. So we are quite proud with all those results that we have seen, and we believe that it has been a result of a combination of early and determined action by the government of Vietnam, taking a whole of government, whole of society approach with a combination of quarantine, of testing, of contact tracing, and of treatment of all positive cases. So these are a very brief kind of description of the situation in our country. I think the details have been provided by Dr. Tan earlier. But we understand that doing well ourselves is not enough. We understand that in this fight against COVID-19, no one will be successful, no one can win unless and until everyone wins. So it is really sad for us to see the increase in positive cases every single day. It has been a morning routine for me now, every morning to check and see the numbers. And it's really sad to see how fast the disease is spreading around the world, and including in our region in Southeast Asia. But it's even more worrying if we think about the refugee camps, if we think about the IDPs, or we think about the conflict zones, especially where the health systems cannot and is not able to cope with the severity of this kind of pandemic. And I totally share the comment made earlier by some speakers about, water, clean water and sanitation is a luxury in some places. We are taught to wash our hands with soap for 20 seconds under running water, but that is not possible in a lot of places, including here in our region and including in my country, in some poor and remote areas. So we cannot really imagine how terrible it can be if an outbreak happens in one of those places. And here I want to emphasize the extremely important role of the WHO and the UN system, as well as humanitarian agencies, who have so far, according to the UN reports, reached about 100 million people around the world to support them in the fight against this pandemic. And because we are currently a member of the Security Council together with Indonesia, it would be remiss of me not to mention a recent resolution by the Security Council that highlighted the need for a ceasefire and a need for a humanitarian pause to allow for international actions to fight against this pandemic, especially in conflict zones. As we talk about the WTO, I think it is very good news to see Helen Clark, former Prime Minister of New Zealand, as well as Madam Ellen Johnson Sirleaf, former President of Liberia, appointed as the lead co-chairs for the review of the WHO response to the epidemic. I think having these two women leaders taking charge of this review will be an extremely important factor to ensure that we have a good review and good recommendations for the WHO as we move forward. I believe that the ASEAN and the EU can take the lead in continuing our support for the WHO, for the UN system, and for multilateral cooperation in general. And this leads me to the next point that I want to make about the Agenda 2030. Together with Anna, we're very proud and happy to be part of the negotiation, developing this agenda for sustainable development. And I think the agenda, in fact, already back in 2015, kind of sent us an early warning that epidemics like COVID-19 could happen. And it urged us and created SDG number 3, in which it urged governments to invest in universal healthcare, to invest in development of medicine and vaccines, and invest in immunization and developing healthcare systems that would be able to respond to epidemics like COVID-19. And in fact, when this happens, I feel that it is a kind of a vindication for the 2030 agenda, and it highlights the importance of continuing the implementation of this agenda, even though we have seen a lot of problems and the efforts to implement this agenda is being hit hard by COVID-19. But I think it is of utmost importance that we continue to focus our efforts, our political determination on the implementation of the 17 SDGs as we cope with the epidemic, but also focus on building back better. This will be the framework for us to continue our collaboration. For ASEAN, I think ASEAN is strongly committed to the SDGs. We believe that regional cooperation can be leveraged to support national actions. And I believe also that EU and its member states, including the Netherlands, can help and support ASEAN efforts through the UN system, through the WHO, as well as through our bilateral collaboration. Two more points I want to make very briefly. One about vaccine. I echo and I fully support the point made earlier about vaccine being a global public good. Vietnam is currently taking part in these efforts to develop a new vaccine for COVID-19. And we believe that once a vaccine is available, it has to be made affordable, accessible, and available to all, and not limited and or being hindered by any intellectual property kind of hindrance in order to ensure that everyone can get access to this life-saving vaccine. And the final point I'm making is that Vietnam is working with a number of countries to soon propose to the General Assembly of the United Nations to endorse and appoint an International Day for Epidemics Preparedness. We believe and we hope that the General Assembly will endorse this initiative so that each year on this particular day, the world will be reminded of the importance to be prepared for epidemics like COVID-19, instead of having an epidemic happen to kind of remind us of how important it is to be prepared and to prevent epidemics like this. And we, of course, we look forward to everyone's support for this initiative. And once again, thank you very much to the organizers, and thank you personally, Anna. It's great to see all of you, and it's great to see you personally. Thank you very much.
Thank you so much, DG Viet. And I think you raised a very two important point, and I think everyone, every one of us in this virtual meeting can really agree and support. And with regard to strengthening support, unconditional support for multilateralism, and you pointed out earlier that it is also the time for us to translate our commitment to support the WHO, for example, and also the UN system, both the humanitarian development system, with regard to handling the unfolding impacts, the severe impacts of pandemic, the global pandemic. And number two is, I think all of us, especially those who are in the developing part of the world, cannot agree more with regard to the importance of equitable access to vaccine and medicines. But also, of course, that leads to a very important question: are we all in agreement that it should be a public good shared by all? Without further ado, I'm going to move on to the next speaker now, Mark Versteden, Strategic Policy Advisor at the Asia and Oceania Directorate of the Netherlands Ministry of Foreign Affairs. Mark, I believe that this is not our first time to collaborate. And Mark is a career diplomat and currently works, as I mentioned, as Strategic Policy Advisor at the DAO Directorate of the Minguza. And he was posted as Deputy Head at the Permanent Representation for Disarmament in Geneva and Head of the Economic Affairs Department in Canberra, Australia. And prior to that, Mark also worked on the NATO and OSCE affairs at the Security Policy Directorate and at Asylum and Migration Affairs Division. Mark, I think a lot of speakers already highlight on the specific areas of further collaboration that can be further explored, whether with regard in the context of bilateral relations of ASEAN countries and Netherlands, or within the context of ASEAN and EU. And we would like to have your highlight on that, if it's possible. And the floor is yours now, Mark, please.
Thank you so much, Anna, and good afternoon, good evening, wherever you are in the world. It's really a privilege and an honor to take part in this webinar. And my compliments really to the Indonesian Embassy for organizing this, and of course for the ASEAN Committee in The Hague to setting all of this up. Because I think indeed it is one of the things we should do between the Netherlands and ASEAN, but also between the EU and ASEAN, is in these times that we all are faced with the same issue, with the same pandemic that hits us all, is to compare notes, share best practices, see where we can cooperate. And I think that is very important and very timely. So thank you very much for organizing this. And like I said, I'm happy to be a part of it. My words were stolen by the previous speaker, because that's exactly the point I wanted to make. The importance for countries like the ASEAN countries, a country like the Netherlands, we are, you know, small, middle-sized. My previous director always called us a pocket-sized superpower. I like that one. Countries who depend for a large part on multilateralism, on cooperation, on the rules-based system. That is how we attend for our security. That is what we need for trade. That is what we need to function in the world and to deal with, especially with now issues like COVID-19 that hits us all. And it's in our ministry, when COVID hit, we started to work in several groups and started to think about what does this mean, you know, not only in medical terms, what are the consequences of this pandemic for our foreign policy, what we have to do for our cooperation. And what we see, especially when it comes to geopolitical terms, is that a number of developments that were already ongoing actually accelerated because of that. And unfortunately, that means that one of the, excuse me, my daughter is calling. This is what you always see on TV. And then you have to deal with it yourself. I have to deal with that later, so excuse me for that. What we see is indeed that things have accelerated and go basically at the cost of our cooperation, of the multilateral organization. And you see that certain countries who could be in also leading, you know, the how to deal with COVID and what they would have done in the past, instead of withdrawing themselves and also taking with them basically multilateral organizations, leaving them. And there's at the moment not really a collective effort going on to deal with the pandemic, but we see, or we witness, of course, today more of sort of a blame game, which is not helping. We therefore think in our exercise, in thinking about what does this all mean, how can we indeed increase our cooperation? And as I started saying, one of the most important things we think, and that's definitely where the EU and ASEAN see eye to eye, and we already said this in the past, but it's more important than before, is that we should cooperate on well, defending, but also making better where we can the multilateralism and the international rules-based system. And especially we hear today from the colleagues who are working at the WHO, how can we strengthen the WHO and how can we make it more effective so that we even are in a position as a world to deal better with pandemics when they arise in this one, but also when they arise in the future. A lot of things, other things where we could cooperate between the EU and ASEAN have been mentioned by other speakers. They were all on my list, but I was writing along and I think like, yes, of course. So first of all is exactly what we do now on the best practices with COVID, on medication, on dealing with the vaccine, medical supplies. Because one thing in the Netherlands, we had a big discussion and we still have a big discussion, is that we saw this pandemic made us see how strategically dependent we are on certain countries for medication, medical supplies, and we have to have at least a discussion, how can we diversify that? How can we work together? Because I think there are more countries in that position, and we have to see how we can help each other to not being dependent so much on one country, but maybe that we can help each other to be to diversify the elements. What was mentioned also by the Thai ambassador, which was also on is how can we work with together on the economic recovery. And one thing that was also on our agenda is that we can use the connectivity agenda maybe as a basis for that too. You know, and it's especially the digital part indeed, as was mentioned before, but also on sustainability and the climate, because that's the other thing that does not go away. So that would be maybe something where we could work together to also ease all of us the economic recovery that we all need to deal with. I echo what was said about the building back better. We had our advisory council on international affairs a few weeks ago published an advice like, you know, indeed, if we solve COVID in a large part of the world, we only solve it when we solve it everywhere. So let's help those areas in the world. Let's deal with those areas in the world who need more help in doing that. And we currently, as the Netherlands government, are looking into getting money for that to do our part with that. And only this week, the World Food Programme once again underlined it's dealing with the disease, but also with the consequences of the disease. The hunger will increase in these areas. So yes, we have to talk about food security and food safety. And indeed, I want to echo too in that, and especially a country like the Netherlands is also well positioned because of our knowledge in this area on how we can work together on water management, water sanitation that was mentioned by several speakers. I think that we're about my 7 minutes. Maybe let me end by that I know that the German colleagues who will be chairing the EU the coming half year have also put cooperation with ASEAN in the light of COVID on their priority list for the coming half a year. That's of course tied to the discussions we had in the past and we still are having about the strategic partnership, but the strategic partnership may be more needed than ever to make also at the highest level to have those discussions between the EU officials and the higher officials from ASEAN. And last but certainly not least, some of you may have already heard that, but for the Netherlands to underline really the commitment we have to ASEAN, we are currently in the process of becoming a member of the Treaty of Amity and Cooperation. My Minister of Foreign Affairs sent 3 weeks ago, I don't know when the summit exactly was, sent a letter to apply for the membership. And that is what I understand being dealt with at the moment by the ASEAN countries to see if we can become a member. But once again, it's really to underline the importance we attach to cooperation with ASEAN. Thank you very much. And that is from my side. Thank you, Anna.
Thank you so much, Mark. And picking up on what you highlight earlier with regard to the potential of cooperation in the economic recovery and also in the digital platform, I think a lot of speakers already highlighted the importance of or the role of information and communication in this time of pandemic. And I think a lot of countries are also having problem on how to control the spread of, misinformation or ineffective communication to reach to the grassroots and also hoaxes. And I think that's also one of the particular area that the Netherlands can also further explore on the with regard to cooperation with the ASEAN countries. Thank you, Mark. And our last but not least, of course, speaker is Dr. Rahmawati Hussein, or usually go by Ama. Mbak Ama is the lecturer at the University of Muhammadiyah Yogyakarta and assistant professor of the Yusuf Kala School of Government, as well as, of course, a very active proponent of Muhammadiyah. And she's widely known as an expert on urban and development planning, change management, and disaster risk reduction. We work a lot, and also with Dr. Jamila, Mbak Ama, with regard to disaster risk reduction. And of course, currently, Mbak Ama is the Vice Chair of Muhammadiyah Disaster Management Center, the Central Board of Muhammadiyah. And she has English literature as the educational background, and did her master in community planning from University of Cincinnati, Ohio, USA, and PhD in urban and regional planning, focusing on disaster management from Texas, A&M University, Texas. And if I'm not mistaken, Mbak Ama, you're still serving as the member of UN Surf Advisory Board until 2021, if I'm not mistaken.
Yes.
Right. Mbak Ama, the floor is now yours. Oh, I just need to highlight that Mbak Ama is a strong, what the Muhammadiyah has done, I think is one of the best example on how the civil society can further support or effectively support the efforts taken by the government and the community to fight the spread of pandemic, disease and pandemic. Thank you, Mbak Ama. The floor is yours.
Thank you, Mana, for the long introduction and excellencies, distinguished panelists and colleague. It is my privilege to talk in this very great webinar. I would share first my slide, please. For those of you who haven't heard about Muhammadiyah, Muhammadiyah is the oldest organization. Oh, not that one. I made the one that I sent in the email, but if not, then for those of you who doesn't know Muhammadiyah, Muhammadiyah is one of the largest organization in Indonesia, which is member estimated 35 million, more than Netherlands population, and we are present in 34 provinces, and we help in responding the COVID, since Muhammadiyah also has the hospital across the country. We have 437 health facilities. So in a great demand of the increasingly COVID patient, Muhammadiyah Hospital also serve to respond the confirmed status, the monitor status of the patient right now in Indonesia already reached 72,000 cases, and then 30,000 are recovered. That's a positive side, but we still have a high death up to almost 4,000. So Muhammadiyah as a religious organization, we see that it is very important to also helping or also assisting the public health by educational campaign, by providing information, especially in many countries, not only in Indonesia, the religious organization been also considered part of the problem because of the congregation or the follower, and then the mass activity. So what we do, we also providing guideline to the Muhammadiyah member across Indonesia not to pray in the mosque, praying home, for example, and then we also encourage them to do the sanitation, hygiene, and all the campaign. And what I want to also address that almost half of the member are women. In regard to the women issue, we also see that as the previously speaker mentioned, that most of the women are affected very much. So the women here, especially in the household, is very much hit by the economic and social impact. The increasing the violence against women in the domestic side, and also the issue on the food security been hampered, been affected women a lot. So what we do in Muhammadiyah, we also support working with other organizations. We right now currently working with the several international donor and NGOs, with the DFAT Australia, with UNICEF, USAID, and several other. We work to support the food security program throughout Indonesia. So what we do is creating the urban urban food security through urban farming. And also we are working for helping the small scale businesses, especially the women businesses, as they are mainly working at the informal sector in urban areas. And then we also support the chains, as Indonesia right now, many farmer cannot sell their products. So we try to help linkage the rural and urban side by helping them with the digital platform to market the product in the urban area where they are also lack of the resources. So this is part of the food security program. And with the university that we have, and since Muhammadiyah also have 173 higher institution, university, college, we try also working with the laboratorium to help the government to do the PCR test, and then to do the tracking and tracing, or the Muhammadiyah hospital to respond very quickly if things happen. So what we do is not only through the hospital, universities, but we are working through the network throughout Indonesia. This slide, okay. I just go next. So I'll just go quickly. This is next slide. Okay. This is the one that I said. So there's a present in 34 provinces. This is all the institution that we have. So Muhammadiyah creating Muhammadiyah COVID Command Centers in all provinces in Indonesia. Next. Because I will only use for 7 minutes. Next, please. This is the area that we work throughout Indonesia, and stop here. So far, Muhammadiyah also can increase the donation within the organization. We managed to get the $12 million within organization from the universities, schools, and all the resources that we have to help to provide the personal protective equipment, or PPE, because we see in Indonesia right now increasing number of the death of the health worker. So we try to ensure that the health worker who work in the Muhammadiyah hospital is not affected by the COVID, because right now there are 112 doctors and nurses. And we try to provide the PPE for the health workers, especially for the nurses, because 70% are women. They are mostly affected. So it's very important here to provide the security or the protection toward the health worker. And we also provide the food for the low-income peoples, because before COVID is already many in Indonesia, urban slum area and other rural community, and they already got difficulties in accessing the food. And then after COVID, they lost their job, they cannot even get the food. So what we do, we distribute the food through our branches, and also the most important, providing next, please. I just go through next. This is all the hospital that, because next. This one. So what we do is also try to do the promotive or preventive program. We do the call center not only for health, but for psychology and religious issue, because as I mentioned, the issue on psychology is increasing, the violence, the stress, the depression, and then there are many asking about the religious affairs, how to do the religious activity during the pandemic. And then we do also webinar regularly for topic every week. So that's to increase the awareness and educational campaign on how to prevent the spread of the COVID. I will go ahead. Next, please. Next. That's before this. Muhammadiyah is also a proponent of network network, and this we try to do to collaborate with the NGO in Indonesia. Next slide. So far we have the 24th national organization. Next slide, please. Last one. Okay, that's national. Not the before this. Before this slide, please. We have 26 national network, 34 subnational, and 600 subnational NGO and GSO. We try to work together to share the experience, the best practices, and lesson learned among the organization, so that we can do better and stronger by working together. Next. And what we do through the Sejajar, the Nectar, among Nectar, we already have the 2 ASEAN NGOs webinar forum. We call for ASEAN GSO to join the ATMER group for the involvement of GSO in the ASEAN. And then we want to institutionalize the share lesson learned and best practices. And then how we could align as well for sharing purpose and understanding the complexity and complementarity of the NGOs toward the government and the to respond the COVID in general. So what we do is Muhammadiyah working internally and externally with the Humanitarian Forum Indonesia and also with other GSO and Sejajar. We've been working with the ASEAN. So I see there are potential collaboration that we could address not only through the government side, but GSO, especially in developing countries like in the Philippines that mentioned, in Indonesia, even in Myanmar and Thailand, been contribute to the respond COVID-19 in ASEAN. I think I will close with that, Mbak Ana. It's already 7 minutes, and this is a good opportunity. And thank you for the time.
Thank you so very much, Mbak Alma. Indeed, very well spent 7 minutes. And I would like to, of course, you raised so many important points there in your 7 minutes presentation. But if I may just highlight one important aspect is that how the government and international organizations can take advantage from the CSO's vast and extensive networks that they have worldwide, especially in the time of I was about to say in the time of cholera, but it's a different humanitarian crisis now. In the time of COVID, in the time of Corona, I think we should explore how can we capitalize on the very fast and extensive network of CSOs. Thank you so very much, Mbak Ama. And if I may just know if Mbak Dias is still here with us. I have to inform all the participants, though, that regretfully, we have to say goodbye to, of course, Dr. Jamila earlier, and also DG Viet because of their unforeseen, unavoidable commitment somewhere else. But I believe we still have Mbak Dia, Mr. Mark, and of course, Mbak Ama, and Ambassador Leda, of course. Yeah. And if I may just go back to Mbak Dia, if we still have Mbak Dia. Okay, Mbak Dia, are you still with us?
I think
Yes.
so.
Hello, yeah. Hi, Mbak Dia. I'm so sorry, but we have to come back to you on this.
Excuse me. Can you repeat the question?
No, not yet. You know, I haven't got into the question part yet. We just need to check first whether you're still there or not.
I am.
All right. Thank you, Mbak Dia. So thank you very much. I think all of us understand that at the global and regional level, and of course at the national level, the government and also in partnership with civil societies and other relevant stakeholders are doing their utmost to ensure that they have what they need to control or mitigate, to control the spread of the disease and also to mitigate the impact. But we talk about the WHO and of course in general what the UN system has, both in the humanitarian and also in the development system. We do have the normative frameworks. We do have the institutional the institutions. But then what seems to be the gap on what we have, especially at the global level and maybe at the regional level, with the implementation, especially when we talk about the grassroots level, what seems to be the widening gap? Oh, no, I'm sorry, too judgmental. What seems to be the gap between the normative that we have and the operational level? If you could just highlight or further elaborate on that, but
Yeah. Okay, so thank you, Mbana. That's I think that's a $5 million question. That's a very loaded question. I think, as I've highlighted in my presentation, the essence of this pandemic taken us all by surprise. And the surprise, I think, goes in different magnitudes where you are situated. So you are at the global level or at the community level. um, the surprise is universal but different in magnitude. And it at national level, perhaps that element of surprise is coupled with the, the national preparedness element that perhaps um, was not being regarded as too important before the pandemic. So national preparedness in health emergency situation, and it's not yet a uniform or a common priority between countries, and that in the impact of that is on the policy aspect. Whereas at the public side or at the community side, people are not familiar with what is actually a health emergency, what type of disease is this, prevention or public health measure or individual response that needs to happen to not to mitigate, but to just safeguard, individual safeguard and community safeguarding against the transmission of the virus. So that element of surprise, I think, threw us off somewhat. And that is, at this point, is where WHO comes in with solid technical guidelines. And also above the guideline itself is the framework, which is available also online. So the strategic framework by which we ask the world to go beyond surprise to tackle the surprise and do something concretely, I think is explained in quite detail in the strategy. What must the national government do? What communities can do? How to protect vulnerable populations and so on. That is, I think, what we have to come to terms with and to be able to look, then refer back to the technical guidelines on what is actually the actions that we need to make, both for now at the current situation while the pandemic is still going on, but with also acknowledgement that there will be time where the pandemic is behind us, and that is the sustainability issue. So I take an example of now we don't have immunization program is suspended, antenatal care is suspended, perhaps to a certain extent food security and nutrition program is being put on hold or on the side. That those elements are the elements that we must bring to the design of the new world that we are going into, because there will be a time where the pandemic is behind us, and then we will have to go back and question and answer the ideas or the strategic importance that we leave for now, for the time being. So that is the I think the magnitude of issues that we have to deal with, and that impacts mostly on the social determinants of health issues, where it's somewhat it doesn't feel that it's emergency, but it is prolonged issue that we have never be able to deal with before. That is what we have to categorize now, living today, and then we have to live also and plan for tomorrow, where we have the pandemic, we are reeling from the cause of the pandemic, but we have also need to go back to redo our homework. That is the mostly maternal and child health, nutrition, and food security issue. I hope that explains. And then the what, if you ask what must governments do, I think the ideal policy direction would be to tackle now, but with a very long vision ahead of what's going to happen after the pandemic is over. I hope that clarifies somewhat.
Thank you, Mbak Dia. And now I'm picking up the questions coming from the floor. And one is from Johannes Cristianto for Mark. How to maintain the trust of the EU member states towards EU and the legitimacy of the EU itself in terms of tackling COVID-19 problems. I hope you, Mark.
Yes, I'm here.
Yeah. Did you get the question?
If I can solve the EU, no, I cannot. The EU, of course, when we at the beginning of this pandemic, was the first reaction was very national, but that's not because as an EU we may not cooperate, but it is also part because of health is not an EU competence. So it's a competence of the member states. That's how it's arranged in the EU. So having said that, maybe, of course, and that's what we all have to see when this is over and we look back and we evaluate, we could have done more from the beginning to coordinate and to do more together. But there was a lot going on of coordination also in the beginning of the COVID response, as was also mentioned by Mr. Beck from RIVM, that you had between areas on both sides of the borders maybe big differences in approach. Now we are, of course, back to coordinating, talking to each other, going back, taking up where we left off, basically as an EU. And we are about in the coming weeks to agree to the biggest recovery package the EU has ever agreed on, basically. So I think that's quite a leap forward. And although we have our differences how best to approach it, there's no difference whatsoever, is that we agree on something like this should come. So I think that the EU, because the COVID also made us realize, I think I was myself, for example, in Paris last Monday for consultations on a lot of issues, but that we all need each other because simply we are too small to do it alone. And that's what we knew all along, but COVID reminded us of that once again. So I think that as an answer.
Thank you, Mark. And but I agree, though, it affects us all, and that's why we need to cooperate and collaborate somehow and at some level. That's a necessity. And now it's a general question with regard to. Oh, this is for Ambassador Leda and maybe Mbak Ama as well. With regard to the general collaboration between ASEAN, EU, and the Netherlands, and for Mark as well, then, to fight COVID-19, which I think maybe apart from Mbak Ama's presentation, already highlight some of them by you, Mark, and also by Ambassador Leda as well. but in case Ambassador Leda and also Mark, you still have some other additional elaboration on what you have presented with regard to the collaboration between the ASEAN, EU, and the Netherlands to fight COVID-19?
Especially to underline that also at the beginning of the crisis, that the EU and ASEAN were already in contact about health issues. So this is not something that we came up with during the crisis or that we come up with now. It's health has been put when the COVID crisis came. It was only natural to add it both on the ASEAN side, both on the EU side to the agenda. So there is a discussion going on between EU and ASEAN on health issues. And we, it's maybe not, we from the beginning already exchanged best practices, what was going on and how we could cooperate more. So I only expect that to pick up more when we have after summer, if I'm right, the normal dialogue between the EU and ASEAN again.
Thanks, Mark. Ambassador Leda, if you have any further addition to what you have presented earlier? Oh, okay. Maybe we can turn to Mbak Ama now. Mbak Ama, I think you have highlighted and all of the civil societies and their excellent work in supporting the fight against the spread of pandemic. If we have to do things differently with regard to further strengthening the partnership between the government and civil society, what would be your suggestion?
I think the public health awareness is still become a major issue, especially like in Indonesia is less discipline and things. The public awareness is still a challenge in Indonesia since we have a very big population and also archipelagus country. So some need to be reached out further. So the help of the international organization or foreign or overseas government will help in reaching out all the 14,000 islands. And also the gap is mostly on not only the access of information, but it's also the access of health is still an issue, especially in remote area. We still need to further improve. And the other important issue is also the long term of the social economic impact. We need to think starting from now that we could collaborate in what way to work in more broaden engagement with the EU or the Netherlands and other ASEAN country to improve the strength of the economy of the impacted community, because right now it's estimated the increasing number of the poor or low income people in Indonesia, almost 50%. It's a really big number for the country. So it's very important to address the deterioration of health, education because of the social economic impact. And then as well, the more on, this is also affected not only the people, but for the sustainable development goals, how to reach that if there is a deprivation in the people's lives. So I see that not only addressing some particular, but looking on more comprehensive way, and then working not only with the government is very crucial, especially in the country, archipelago country like Indonesia. So I think the gap is on that, Mbak Ana.
Thank you, Mbak Ama. And I don't think we have any more questions coming from the participants for all of the speakers. And also because of the time constraint, unfortunately, although it may sound a bit cliche, but thank you so very much for the very fruitful discussion, and of course the the knowledge and best practices sharing that has been shared by all of the speakers. And if I may just highlight it, what earlier been mentioned by the Deputy SG of ASEAN, what happens when the vaccine is now here or is there? I think the question is no longer about whether we have the vaccines or not, or whether we have the treatment or not. But I think we need to change the paradigm. And when we talk about changing the paradigm of thinking, we specifically address the grassroots level, the society, that they really need to keep adjusting to the new normalcy. Also, I understand that some of us don't really like the words new normalcy. Maybe some would prefer to say the transition. But then again, that really emphasized the need that we need to constantly adjusting to the evolving health needs, for example, especially at the grassroots level. And although all the speakers highlighted the big things that need to be further done or further explored with regard to international cooperation, for example. But then again, at the simple things or things that really resonate to the daily life of the people and community at the grassroots level, like how to improve their sanitation, how to improve water management at the community level, for example. And see, this is also why Dr. Jim earlier also highlighted the importance of public communication, effective public communication. And that's why we also need to further strengthen the capacity of our digital technology and also strategy to outreach to the community level. But also, not to leave the big elephant in the room, it is also the imperative time for us to really redefine meaningfully or translate international cooperation and international solidarity to be very, very meaningful and a benefit to not only states but also reach into the community level, as highlighted by all of the speaker earlier. Any states cannot do this alone. And if we want to be state, for example, if we choose to be to implement draconian style, for example, we're just going to stop, we're just going to close our borders. That's a definitely no go. Or we're just going to stay focused on the one side of the dimension or one dimension of the pandemic, for example. We just want to control without striking the delicate balance of the need of maintaining the economy to keep it going, because by the end of the day, we need to keep the economy going in order to benefit or to meet the needs of the people as well. So I think the multidimensional aspects of pandemic really gives us an awakening moment to rethink our way of thinking and also redesign our way forward, of course, and also especially in terms of international cooperation, as mentioned by Pak Fikri earlier. With the population of more than 1 billion, ASEAN and EU can definitely do more to ensure that when it comes to achieving the highest attainable standard of health for every ASEAN and European people, the partnership can do a lot. And I really appreciate for all speakers as well for identifying the potential areas of cooperation that can be further explored between the ASEAN and EU, and how we're gonna position the Netherlands in a very unique role as a hub, maybe to further bridging the strengthened cooperation of ASEAN and EU, including in the context of addressing or early detection or even maybe preventing possible future health crisis. And of course, this will be very beneficial for all of us, all of the potential areas of cooperation that has been highlighted. And with that, we really hope that what we have been discussing in more than 2 hours, I'm sorry for the prolonged time, can really benefit all of us, especially the participants of this webinar. And thank you again for your participation and for the excellent speakers. Thank you doesn't even cover. We really appreciate your time and your expertise and your sharing as well. And maybe Mark, on a personal note, maybe we look forward to collaborate on the another webinar on the Netherlands and the TAC. All right, thank you so very much. Have a nice day.
Thank you.